development without guaranteeing our cattle. The eradication of the feral mouth are not only health objectives but also a very important condition, strengthen the trust between our consumers and guarantee the sustainability of our agricultural activities. In this sense, the work articulated in the productions, health and safety, international organizations is the way we have been following in order to continue advancing forward with strength. Bolivia today has demonstrated a very strong compromise with health and safety, and improvement in agropecuaries is the perfect scenario to rectify our commitment with excellence in cattle breeding. Our sector has grown up thanks to thousands of producers that you are going to meet today. They are here present, and this has motivated, without any doubt, to generate good practice, always in the way of sustainability and welfare of the animals. Bolivian producers today reaffirm our commitment to be working as a team and strengthen this cooperation links, move forward all the initiatives that allow us to continue moving forward. Let's continue working and building a future where productivity and the sustainability go hand by hand, consolidating South America as the leading region in the high-quality cattle breeding. Thank you all very much. May all you be welcome.
Such important words from the President Desmond so a lot of important moments, and we must to give the recognition to all of them, as in May they have been trying to do with the organization. Of course, Bolivia and Brazil, we thank about all the words to receive. I will invite to the President, Dr. Walter Rivera, so he can join us to make some words. Good morning to everyone. Welcome. Hello to Walter Munoz. I want to say hi to the director of Senasac, Engineer Kills. Alberto Junior, Vice President of the CAL. Also, Autorino Cosidi, who is representative of Panatos. To our President of Sarabini and Vice President of Conabol. To all the producers, all the visitors, and the people who's joining us today. I really love the work today. I want to direct to professional in the agricultural sector and representatives and friends. Today I want to talk about the important event as they plan the 51st seminar against the mouth and throat disease. We are honored to be our sponsors and to join us to also with Senasac, whose purpose is to recommend the actions against and control and eradication against the mouth and throat diseases, as also it's also eradicated in a lot of countries. As a strategy, we be monitoring the control, who has allowed us to make the license, but now we want to embrace and challenge to be free against the mouth and throat diseases. So, as in fact, we want to show how the development be increasing with 1% and another percent yearly percent for more than 44 tons, and it's increasing each year against the public sector. Development
scenes in which in the area of the Chicatanía and the Department of Santa Cruz in 2006 we reached the certification of free with vaccination in the Department of Oruro, and here we have some in 2007 we had some focus of foot-and-mouth disease, five outbreaks, and facing this emergency is something very important that for the productive area of private. Facing the emergency opportunities arise that sanitary structures, so in the case of Santa Cruz that we are, after the outbreak, it was created a support unity to the program of the eradication of the foot-and-mouth disease, in which the first participation from the producers was created with the finality of strengthening the execution of the vaccination campaigns in the department. And something even more important, part of those apports are by the producers. The first emergency fund is generated. This is where the first emergency funds are created, facing the outbreaks of 2007. Continuing with the certifications and the process of certification of foot-and-mouth disease, in 2012 we certified the area of the Andes. As you can see in the map, you can see the light blue color area. In 2013 we certified the valleys and plains. In 2014 we will receive a full certification for the whole country, divided into areas, the green area with vaccines and the light blue with vaccines. In 2018 we received the certification in the Department of Panamá in the area in the north of the country. In 2023 the Department of Beni and north of La Paz are recognized as free without vaccination. In the same year the Department of Santa Cruz, which was the only department that was doing vaccines, lifted vaccinations, and right now we are waiting for the certification in May, the certification without vaccination, free of foot. This has been our way since 2020 of the program of eradication of foot-and-mouth disease. But what was the challenge? After vaccination, we are working with certain components, and for us, the private sector, according to the alignment of the hemispheric plans, we have the next challenges. Strengthening the institution. What is institutional for strengthening this? To consolidate the alliances in the private and public sectors. The first topic is to migrate the financial resources. Something very important is that, just as the case in the last department that we lifted the vaccinations, Santa Cruz, 23 years vaccinated, in which we had consolidated the structures, cattle breeder apports. So the challenge was to migrate this apports and make them without vaccination situation, without vaccination. So in order to have those resources, strengthening in the surveillance of the epidemics. So these resources can be of a quick response, so we can attend all the outbreaks quickly. These resources may keep all the technical veterinary structures, giving the sustainability, finance and administration in this process. Something very important in point 6 is to generate the trust in the producers. I think this is very important in this stage of the strengthening in the surveillance, giving them a guarantee, a technical guarantee in assistance, and also economical guarantee in the structure of sanitary may support the producer if in that moment it's going to use the sacrifice to contain the disease. And as point 7, consolidate. Point 7, move to new technologies in order to improve the strengthening and the surveillance, especially sensibilization when we talk about the report of the suspicion of disease. And like point 8, we consolidate the bank of vaccines and antigens. As we move forward in this process, two were signed with Senasag and also with the cattle breeders in Santa Cruz, as the cattle breeders in Beni, in the year 2020. with Vega Beni and with Vega Santa Cruz in the year 2024. What is the finality of this? Is strengthening surveillance, especially focusing in the structures that are based in a cattle breeder port. So when we have that status of vaccination, to move to a status without vaccinations. Something very important that the emergency funds, but also there is something in the case of Santa Cruz. These funds were broadened into compensation funds. With this to sustainability to the public-private structures, we consolidate the emergency funds, we consolidate the compensation funds. The coordination instances, private and public, these are very important, are ruled in our general three instances in which we coordinate between the public and the private. The national instance, we call it Cattle Breeding National Congress, in which participate CONCABOL. The departmental instances, we call it GANES, Cattle Breeders Departmental Conference, in which the cattle breeders departments participate, and also the CONCANs are the municipal congresses of cattle breeders, in which the cattle breeders associations participate, who conform all these the official services, the productive services, the governments, the insum centers, the police, and in many cases also some municipalities participate also, and sometimes the army. This is a very important moment in which all the work, technical work, is coordinated. The year 2024, these instances, we had 20 meetings in the department and 140 at a municipal level. The first activity, the main activity, is capacitation and coordination between the public and private sector. This coordination, visiting the farms. We also coordinate the work of all the serology works which were made last year in order to get the certification for Santa Cruz and the approval of vaccination plans. We have in some departments a massive vaccination programs, like for example rabies, in which we keep a structure in the field, is constantly going to the communities, small and medium producers. Strengthening of the private sector in the topic of the surveillance. How do we work in this instance? Mainly these instances, we do the evaluation of the risk factors in each municipality, which are the risk factors, and identify the possibility of disease. We can to determine the cause and in order to do the prevention. For this, we need the data recollection from different sources, and this is very important in order to work with private and public sectors, veterinarians, private veterinarians, veterinarians that work in municipalities, being able to include in this surveillance network all this work we do in the framework of coordination with the official service and the governments. In some departments, they have sanitary structures. At the moment, we have been able to identify in the network of surveillance, in the participation of the private sector, as you can see there, around 1,491 veterinarians, of which some association of veterinarians 63, and slaughter abattoirs 61, and control posts are very important in interdepartmental. The coordinated work between the private and public sectors, exportation veterinaries, but you also can see veterinaries of private practice. I think that is a challenge for all of us. We have around that are in the field doing assistance, around 1,300 that we have identified that we have the necessity to include in the surveillance network, being able to share information with all of them, capacitate them in the topic of surveillance. and also the reports. That is a challenge for all of us to be able to work with all these private veterinarians, and that work is translated in a coordination in visiting and coordinating the high surveillance breeds. We also participate with all the events of concentration centers with public and private veterinarians. The avatars also have veterinarians are accredited by officials, and the work that we do with visiting the places of exportation. Something very important is the technical capacitations in the sanitary vocation, and to promote drills. The last drill that we had when was in year 2022, we have considered performing another drill. All that work is performed with the official entities. Well, and for this, the private sector move into an application that has been destined for the veterinarian assistance and will help us in the surveillance of disease, veterinarian and surveillance. This app at the moment is validated, was validated at the end of last year in the field, as you were able to see in the previous video, the work of the veterinarians, and we were giving validation to this application. At the moment, we are working for this to be available for the producers in Google Play and in the App Store. How does this system work? This system work is very easy. We start with a notification by the producer in which they fill a formulary, very easy, with a name, address, and the suspicion of a disease. Once the formulary is being filled by the producer, that formulary reaches the administration of the system in which the information is validated and is passed forward to a veterinarian that is closer to the area of the notification. This makes contact with the producer and makes the first relation with the producer in order to get more information. At the moment, we are working with the veterinarians of cattle breeders associations and Santa Cruz Cattle Breeders Association, and we are going to be including all the veterinarians I was showing you before that are private. There's information and with capacitation. Once this is working 100%, we're going to be part of a information unity in which all the occurrences will be reported to the National Surveillance Service of the official service that is the SINAF. These are the reports of the system. An administrator in which all the consultations arrive from the producer and the reports of the veterinarians with the respective geo reference. Once the producer fills the formulary, sends automatically the place is generated. As you can see in the right side of the screen, all the notifications made by the veterinarians that are within this in the system. This is the formulary that the veterinarian receives in order for him to do the system directly with the producer. The system is structured in a hierarchic order of our national surveillance systems, nervous syndromes, vesicular syndromes, and other type of diseases. And this is what the app generates. This is what the system generates. The results, the reports, and of all the producers, around 184 reports we were able to realize between the months of November and December of last year when we started to validate this system. Who participate? Sorry. Who participate of the app? For the system registration are the veterinarians, eco-veterinarians, veterinarians of cattle breeders associations, and veterinarians of private practice. At the moment, we are working with all of them. And who report? Through the application, cattle breeders producer can report, administrators of the farm, and also the cowboys. We can see the incentive word. Since the program started for all the sense of the was incentive, capacitation and recognition. Mainly, we are taking the same measurements, something that are registered within and those that report diseases, especially with an incentive in capacitation and rewarding the work for the program. Another important point within the advances is what we were talking about before, consideration of the antigens and vaccines bank, the necessity of each and every country to having an availability in the case of an emergency. According to our ruling, the responsibility is of the official service and the National Cattle Breeder Council. In this, what we move forward was the SENASAC is going to be added to the bank of vaccines in Concabol. We have been working since last year to the invitation of some labs visiting an estimation of cost for this supply of vaccines and antigens. We believe this year we are going to accomplish and consolidate our bank of vaccines jointly with the official service. Something very important in order to finish my participation is education and communication in the surveillance is a very important topic, because this facilitates directly all that interrelation between the official services, national, departmental, the private sector, with the producers. Many occasions it's easy to try, we are going to capacitate, we're going to reach the producers, but working in the field is a big challenge that we need to improve more and more every day. What are we working right now? We've been working in capacitation in veterinary producers. As you can see there, all are the organizations, conservatories, with their national experts, generating in informative capsules directed to veterinarians and producers, also a lot of information in video by technicals and informing the producers about the importance of the disease and the importance of the reporting this disease. Seminars, we are organizing seminars. As you can see, last year we organized a seminar with national and international experts that we should cooperate in this work. And the use of the social networks for the broadcasting of all the material. I think all of this is very important. It's a work that we have to complement. It's a challenge that we have to form new educators. I think that is very important in order to improve the program. Concluding, we have moved forward, we have advanced. After the vaccination, we have consolidated firstly between the public and sector public. This consolidate the emergency funds, the indemnization funds, and those funds may be of a swift availability. Also, those funds help to have a financial administration that be sustainable. I think that is very important, so we can strengthen the surveillance of these epidemics. We want to consolidate this year the bank of antigens and vaccines and promote something that I mentioned before, to promote the formation of sanitary educators. We're having a communication strategy looking to reach every level of the producers, but how do we reach the lower levels? So I want to share this image of the technical. That is the work we have to do. The field technician in the middle of the road, stopping and talking to a producer, capacitating, making some sanitary education with them. So that is the prevention knowledge. If we have the producer is informed, if we have feedback from the producer, we're going to have a better data compilation for our sanitary system. Thank you very much.
Thank Thank you very much, Dr. Giri. So we can continue to the agenda. I want to invite Dr. Francisco Prudencia de Castro, who's going to share the development of the strategies in Brazil. Good morning to everyone. I would like to first of all want to thank to the doctor for the advice of Congo and Hangabakiros from Sinasak for this activity in Bolivia in the name of the accompaniment for this present organization. I want to present but also to Dr. Cosino and Dr. Panabideri and to all the authorities joining us today. I want to present a briefly presentation from the Mato Grosso state where I developed these strategies, but also nowadays this national commission wants to develop this type of plan. And now I'm here talking with you guys about the private sector in Brazil and the preparation and the monitoring for the mouth and foot disease. Quickly, I want to show us the cattlemen's private sector plan field. This position is a big challenge against for the mouse disease. The functions and the challenges and the perceptions for this principally are against the disease in Brazil. And now I'm going to present. I'm going to make some details about the configuration of cattlemen and the health and sanitary and equality from the state. I want to show how are the functions in the Brazil sector in a more open way. And I will still try to show this quick view about how Brazil deals with the challenge. There's a lot of 44 millions of livestock, the poultry and cold in this type of country is one of the largest livestock since we have studied in all the country and the sector. But the intermarket also develops this type of prevention which is available in a worldwide way. In Brazil, the country is maybe a unique country is with a major capacity about the livestock in a way of the protein and the animal safety and healthy. The producers with a lot of new technology in a big number of producers and cattlemen. They try to produce in the simplest way with the technology. I want to name some of the new developments. Of course, we must to improve these challenges for the production of meat and the health and the food health in a sustainable way. We must to increase the consciousness and for the safety and sanity in this animal health to improve the production. So we want to prepare as a country for this challenge. I don't just want to talk about the eradication of the mouse and foot disease, but also as a country with a major capacity of producers, but also want to increase the production and the strategies in a sustainable way, because this country in the requiring in agricultural sector, we spend more than 5 million in properties and lands are destined for the agropecuarian sector just for the one activity here present in this country in all the municipalities in Brazil agropecuarian sector. So we have designed, we have developed this type of system using a cynical system from the producers to the cattlemen to the municipalities as a community. All the federations and the states are part of the system. In Brazil, in a federal level, the Confederation of Cattlemen sector and agropecuarian sector has the presence. There are more than 2 million participants in this system, in a general system in this country. This federation education also uses this type of system so we can communicate and develop and know information that demands these sectors, so we can improve the plans and normatives and laws against this type of difficulties and struggles, so we can exchange the production in the Brazil and productive sector. All the laws and normatives and agreements we have as they are as important as the development and the production. So a lot of times we try to increase this type of communication, so we try to achieve against the struggles of the installation of the system to defend the Brazilian product. So you guys can develop this the production of animal and meat and livestock in general in our country. So the commission, some of the commissions are part of this type of strategies are, for example, well, they are divided because of the politics and ideal technical policies. All the investment in each activities in properties. Also, they have this commission. They are part of the commission. So we have this nucleus in an economic way for our sustainability, but also we want to prepare us in the productive area for specialties in this sector. And now I want to share the commission and about the quality and livestock, all of the situations in Brazil around these areas. Also, this commission tries to deal with. We want to liberate this commission in an open way to all the countries in a technical way, so we can capacitate and monitor it against, and we don't want to involve the politics. We want to make some consciousness in the importance about the health and the activities to the producers, because the technical area needs a development. So between all of us, we can develop the strategies, and we can also involve all of them to improve the monitoring. But also, now I want to share one of the presentation about the data and information in a federal commission, so we can transform in a municipality way all the federations that are in the country, but also the commissions and the federations in agropecuarian way. They are also have improved their new participations, so they can bring new plans to the strategies in these commissions. But also all the time we try to convince and to talk about the struggles we deal with, all the participation, our authorities, the commissions, and the new activities are part of this part of commissions are present in this type of activities. All the entrepreneurs, the producers, they sometimes they don't understand how the struggles must to deal with, but we try to make part of, they try to be part of the development of the strategies. Sometimes they don't know how the struggle are dealing with. Sometimes authorities don't know how challenging is the struggle. As a producer of Brazil, they also know because they live with that, but they try to participate to communicate all the struggles. The participation is really important because the federation is useful, so they can participate and talk about the struggles they're dealing with. We have this commission so we can have the information, the data in different graphics. So for example, well, Epinephrine is a new program, international monitoring for mouth and foot disease. The majority of you, most of you, try to use this type of programs, but some of them they launched this type of programs like in 2007. They didn't even know how to use it. The antecedents and the information they used to have is really just part of the private sector. We must involve between all of them, the veterans, the producers, institutions, of course all the producers and the cattlemen and the public sector, because they demand and they have the struggle, so we can go straight to the problem and know from them all the information we need to be against this type of challenge. So the different blogs that we have created, there's a lot of blogs that we have created. There's a transition we want to develop, and all the federations and indicators are part of this type of commissions, and the confederation also participate in the activity of a national program. They show that the producer always want more, but they need respect about how they produce and how they develop the strategies they have, because they already know the struggle that they deal with. But as an ultimate stage, we want to discuss and we want to, on a national level, try to deal with all the struggles as one team in one activity. We all agree in an individual or as a team that the monitoring is a big part of the struggle. We discuss about the type of control that each of the sectors try to make, but if you are present in these type of activities, of course you can share all the information. It's a favor that we planned. We also want to understand how you deal with the communicate about, for example, the private funds, but the resources, especially for the public sector, it's more bureaucratic for the financial resources. But in a private funds, it's more they keep for themselves for the crisis and emergencies, but they have the possibility to develop and also share the assets and the financial resources as a problem required in a contingent and emergency fund. For example, each state in Brazil, it's obligatory to bring type of financial resources to develop the program. But if a state has more resources, financial resources than other, well, it will have more data and information so we can develop. For example, Mato Grosso as a state brings more than $6 million that brings to the program. So these funds are being useful for the program, and the administration of this type of funds is assets will be monitoring also in the program. The control of these funds are a principal objective of the program. So everyone be calm and has the certain information in the best way, in a transparent way. So of course we want internal monitoring and control of the information, not just for the financial funds, but also the procedures and the training of the plans for all the responsibles, for all the participants in this program. The information is quite important also because the country is really big, and all the countries have a big population and different type of sectors and companies being part of the agricultural sector. But now we know that the struggle is big. Of course, we have made some development and achievements, but we need that the private sector also develops a new financial funds and banks of vaccination and resources in a different way. So, of course, in that moment, the private sector, when they participate in this type of activities, they don't try to bring us information, so we don't know exactly if they can bring the financial resources. But that's an opinion of mine, of course, but we must be more responsible of what information we bring to the table, and we must participate in the best way so we can achieve all the goals that we have for our sectors, for our company. And thank you very much.
Thank you very much, Chico, for your participation. And to close the first round of exposition, I would like to invite Dr. Carlos Quilada Melasas to share the experience of the Ecuador Littoral Galapagos of Ecuador. Good morning. First, I would like to thank the whole organizing committee here in Santa Cruz for all the attentions received. My name is Carlos Calada. I'm the president of the Cattle Breeders Association in Galapagos. We are here precisely to see how all the private sector is been working in Ecuador with the public sector in order to control the foot-and-mouth disease in Ecuador. Well, what we have here gathering ashes, foot-and-mouth disease is a very devastating disease for all the cattle with economical consequences, commercial and productive as well, with high significance for our herds. The OMSA, in the year 2015, delivered the free status with vaccination in Ecuador. At the moment, the National Act has 4.7 million of animals congregated in around 170,000 producers. At the moment, we have 17, 18 average per ranch, which makes it even more complicated handling and control of the disease in Ecuador, since there are way too many actors involved. This is a challenge that the public and private sectors we have to overcome. It's been 10 years of being in this struggle. Unfortunately, we are moving forward without any problem, 10 years at least, and with new challenges, like, for example, continuing the state of free for the mouth without vaccination, which is where we're hoping as a country. The private sector is organized through different entities. We have race associations, we have the cattle breeders associations, the clusters in which we are working hand in hand with the agricultural and cattle breeding ministry. It's important not to jump this topic, because the cluster in Ecuador is being seen with good eyes, not only in agricultural topics, in order to open new markets, working hand in hand with the Ministry of Foreign Commerce and Agricultural Commerce. We also have agricultural centers which are in charge of different sons of transporting the information to the cattle breeder, schools of veterinarians and professionals associations. Here are present many of the associations of the country. We have AXO, the Serra of the coast, and different associations of different breeds that participate in all these projects. Well, the alliance with the official veterinarian service highlight the importance of working hand in hand with the public and private sectors in order to continue the surveillance to prevent reintroduction outbreaks, considering national risks and obviously global. The strategies, technical strategies, allow us to work always as vaccinations operators in campaigns against foot and mouth, the technical table and commercials, control of Fibrostilosis disease. As you can see in the graphic, it's important to highlight obviously the appliers, but also how we are compromised, working hand by hand with the public and private sector. We have the presidents of associations, we have the ministers of agriculture, PRS, and also veterinarians in the schools of veterinarians in the country. We all work hand in hand in order to inform in the event of outbreak or particularities. I hope and pray that we don't have to. The idea obviously is to inform as a private entity of any anomaly that may be present. Communications are made hand in hand with the private and public sector, are always present from the president personally. As you can see in the slide, we are always working hand in hand with, and also with the ministers and the agricultural force. Campaigns are really focused in local broadcasting, high spectrum, social networks that are nowadays doing a lot of work, and obviously in-person information. The authorities are in charge of broadcasting all the information, along with the cattle breeders and the associations of cattle breeders. We have broadcasting campaigns and capacitations and other diseases like rabies and brucellosis. It's interesting, in Ecuador right now, we are working together with the prefecturate in that state in the province of Guayas, and the cattle breeders associations. In the first vaccination against brucellosis, the idea is through the vaccination be free of in the province of Guayas, has at least 260,000 animals. The idea is also work hand in hand. We are replicating the success of foot and mouth in Ecuador with how we handle brucellosis, obviously hoping to open new markets. That is what we wish as a country. The funds, the private funds at the moment, from the private sector in Ecuador generates more or less $300 million in order to fight the disease. This comes out of the producers, basically. And adding to that, the state, we have a national alert. In the event of an emergency, we have the necessary funds available immediately for emergency. In the event some outbreak or problem happens in the country, this is being handled directly by the Agricultural Ministry of Ecuador. As we heard before, the vaccine bank is initiative that was born from this space. Ecuador is part since the year 2003 of the regional antigen banks of foot and mouth disease, followed by Paraguay, which was the first. And we are very happy to hear that Bolivia is also being added to this vaccine bank, which is going to be beneficial for all the agricultural Latin American sector. At the moment, the country, through historically, we have had vaccines stock as reservoirs strategic in the event of an emergency. Regional support, we always try to do seminars, conferences, being aligned. Last year we have the participation of the ONSA celebrated in November of 2024. It was a conference regional for the Americas. We work as private sector actively in PRE-COSALFA topics since 2019. I did not assist in the years that were not, but the private sector is present, supporting and working hand in hand, which is very important. It's a nexus form in the beginning. In the first years, maybe it might have been hard for the Ecuadors. We started these 15 years, the programs of vaccination. People were accepted to get to the producers, the cattle breeders. Today, right now, is the cattle breeders who demands and pushes for the vaccinations, obviously, to the governmental entities. And whenever there is a change of government, it's an allicient for Ecuador to keep the actual status of free of freedom of disease. Now the challenges with brucellosis, we are working hand in hand, as I mentioned before. We have very complex topics in the like education, and we need to work a lot in education for the cattle breeders in order for them to vaccinate their animals in brucellosis and opening the spectrum for the provinces to maximize in Ecuador. Well, the challenges we have the local level, national level, and world. We have outbreaks worldwide that are really concerning, obviously not only in Ecuador, but also all the ones that are congregated in this room. The disease has been introduced in Germany, South Korea, Slovakia, Hungary, obviously the presence in Africa, and Asia are very real and present threats for our region. In the regional part, in Venezuela, even if it's true between Ecuador and Venezuela, we have Colombia, but it's a buffer zone in the control, but still is really concerning. Obviously, an outbreak problem of foot and mouth can come from Venezuela. Well, as a country, we have been 15 years without the presence of the disease, in Galapagos without vaccination, and also with panaftosa and air quality means in order to change to the status without vaccination to the whole country. And we are also controlling some other diseases like brucellosis, as I mentioned before, looking for international markets. Since last year, thanks God, working with closers and air quality and the authorities and private sectors, they have opened new markets toward Egypt and Arab Emirates We have for all the permits for Egypt, for the exportation of meat, and here for livestock, live animals. And obviously, this open new markets for Ecuador, which is what we are begging for, we need, obviously, as national shareholders, in order to think about exporting. Well, thanks very much. Basically, within the conclusions and challenges, obviously continue with the status of freedom outs, which requires constant surveillance and shared compromise from the public and private sectors, investing in vaccines and also investing in the regional banks, the international corporations to be always present in all these type of events and strengthening national strategies and guaranteeing stability and continuing evaluating carefully the change of the status in Ecuador, looking forward to a status without vaccination. Thank you very much. Thanks, Carlos. I ask you to take a seat, and I would like also to invite the rest of the panelists to move here in the platform for the questions and answers. Due to the delay that we had at the beginning, we are going to have a shorter Q&A session, like 20 minutes, and after that we'll go into our break. Creo que son dos. Pero
we have this question. We're evaluating the questions in the app. It's more for the year. Maybe it's related to the. It's focused in the monitoring. In the description of the presentations, it says the importance of the private sector and how they can bring guarantees to the modification and the monitoring. So they must recognize the disease, but also the type of area. So how is going to make the identification for the disease? Well, thank you for the question. Thank you. Well, as I was showing in the presentation, practically it's a coordinated work with the private and public sector, so we can bring the monitoring development. As a private sector, we're trying to start in the new type of monitoring in this new field, initiating for the veterinarian sector, also the associations and the companies. We have the departmental and national sector, so we can report the disease because the disease they bring to the field with the coordination to the concessions in the departmental areas. So we want to bring and lead directly to the cattlemen, so we can focus into the assistance, veterinarian assistance, to bring to the producer all the information. Also the identification for the veterinarians in the private sector. We don't have the information, so we can have to include to the monitoring system and also conciliating of information between the areas. So that's the most important part for us. We want to develop this and demonstrate this type of systems. For us, is a really challenging subject. It's a long road. We must bring the stages so we can develop in the best way. Thank you again. The next question is maybe I will make it in Portuguese. Senor Francisco, you talk about the important subject about the politic subject, so the system can bring information and be developed in the best way. We know that this system is developed in for the food and cities. So how you want to work with the pressure to develop the system in Brazil, and how you want to bring the resources to pass the stage of the free vaccination in the country. Well, a really good question. Yes, these sectors is always bringing information we need. Allowed between the federations, this coordination and the communication. Of course, we need to know what the locals need, what they need to be improved, what are the improvements to be need to deal with. So if the demands brings all the information of the veterinary services, but also with the productive area and the private and the public sectors, the confederations will bring the information. We try to bring the communication to the system, but also they also bring information if they need the financial resources, if they need improvements of the structures, if they need the new services contracts and all the different challenges. But also the private and public sector are acting. We must to monitoring all that, because the government always change, and sometimes the government has different type of thinking, and we must to do all the work all over again. The government sometimes is aligned about our objectives with the same page, but when this change, we must to do all the work all over again. So I want to talk about all this. We want to make some consciousness to all of them, not just for the producers, but also the government. We want to talk about information when you see the challenge, but most of the government, they understand and they take action into this, but some of them doesn't take the action, so we need to try to make some conscious impression to them. But now the weather for this type of changes is a really good weather for the consequences and the improvement to all this challenge. Thank you. Carlos, for you also. You also talk about the variation of the register for the different participants as an association to the veterinarian and the agropecuarian sector. The Guardian sector also try to make this status. How is the federation, the cooperation is going to work for the new information, so we have the quality of the information in the best way? Yeah, of course, the authority is also developing a new software as an app to lead to the veterinarians and the public area and the cattlemen in the field. But for the institution, in this case, I don't call it up, is directly stretched with the cooperation and the communication. It's not related to the authorities. It's not in a private way, but the information is relevant the information of the vaccines, for example, the monitoring of the vaccination, how it's going to be worked on, how it's going to be developed for the agropecuarian field. We're trying to work with the public sector to try to make a decision to evaluate the risk, the zones, and information we have, so we can have this information by zones, or maybe for confederations, or maybe as the lands try to work on in different groups. So the different groups are skeptical about the changes we're trying to bring to the sector. The cattleman, of course, has the different mentality about how we deal with the challenges they deal every day. We know that there's a lot of risk, but we want to make a plan against this risk. We want to develop that. Yeah, that's interesting because the information is not directly from the cattlemen or the agropecuarian sector. Yes, we want to make the decision as a team. We of course take the opinion of the private sector, but it's something that we work on. Yeah, we have this list of different questions. These parents are going to be with us, are going to join us the whole day, so each of the participants wants to know that they can make a conversation and talk with them. Because of the time, we must to make this debate, a discussion in a short line, please. The time is really short. Thank you, Carlos, for this session, and in turn for the recesses. Thank you very much.
of prevention and preparation for emergencies within the context of free of vaccination. We're going to wait for a few minutes and we're going to call our coordinators. Manuel Sanchez is going to be the moderator of this interesting second session, which is going to come as well with Daniel Mañez, José Luis González Rojos, which is joining us via Zoom today, Daniel Rodney Gareca, and also Hugo Alejandro Araya. We are going to give a few more minutes, and within seconds we're going to start the new sessions, and I ask for the cooperation of all the participants so they can take their seats. In a few moments we're going to close the outer door so that we don't have any interruptions during these sessions. And now Manuel Sanchez, coordinator of epidemiology in Parastosa, will give him the word so we can start these two sessions, strategies for prevention and preparation in the context of free vaccines context. Good morning, everyone. For me, it's a pleasure first being in this seminar. I would like to thank all the people that has been involved in the organization, also the host as a guest, and all the colleagues from Panaftosa. It's a lot of work what is behind organizing this type of events, and I know you have been to the very last minute looking for this to be a total success. This session that we have planned, in this session we are going to focus in the prevention and also in emergency answer. These are essential concepts for any service, for any country, within the control of diseases. But it's particularly important in areas and zones free of the context of foot and mouth than most part of the countries in the region. On one hand, we have to be worried about avoiding and preventing this pathogen entering our borders. We need to have a prevention strategy, and we can avoid the entry of animals infected that can spread the virus. We need to have a very good strategy of border preventions in order to avoid that the pathogen enters, whether if it's legal or illegally. And also in order to prepare ourselves for emergencies, it's interesting to know the possible impact that the introduction may have. And for that we have tools, modeling tools, projection tools that allow us and understand which are going to be the possible repercussions, and that will help us to prepare in a resource level and also capacitation level. On the other hand, if I want to provide an answer, I need to have a strategy, a contingency plan that covers all the important levels, and also in which all the actors involved at the end of the day may have involved, know, and are aware of it. In order to have well-defined my politics, I have to do exercises of simulations. I also need to have the necessary resources in order to answer, and also the political support. And the last step, if we have the unfortunate event of an emergency, because the pathogen has been introduced, in this case we are talking about a foot-and-mouth disease, I will have to perform a series of analyses, epidemiologic, that are going to help me to provide a faster answer in real time. For that we need to be prepared, we need to have enough information, and we need to have the capacity to do those analyses. Those 4 topics, those 4 blocks, we're going to talk, or our panelists are going to talk about. We are going to begin, but from the end of what I mentioned before, we're going to start with the part of analysis and preparation of analysis in the event of an emergency. And for that, we're going to have Dr. Magallanes from the team of epidemiology of Panastosa. For me, it's an honor to introduce him. So, Daniel, welcome.
Well, colleagues, it's a great opportunity to talk to you today. Well, I want to comment about the subject. The analysis and the data that are important for the response as an emergency in a scenario in a stage where there's no vaccine. The objectives of this presentation is a short presentation. First of all, I want to share this vision, big vision about how is the emergency going to sudden apply. I want to talk first of all about all the ideas behind all the responses and the preparation for a response of an emergency. The objective for this preparation and this response, we must to detect an early attempt and we to see the attempt of the emergency attempt. So first of all, I want to show this image that symbolizes all the idea about how it's going to be the data analysis in this context. The data analysis is going to take action, is going to make a structure for the decisions, so it will be the best decision for the emergency. But let's see, there's not just to see how the data is going to be enrolled. There's a lot of information. It's a big type of information. It must be organized, analyzed, and compared and synthesized. So it could be the base, so it can finally get to a response. And to change the information, maybe there's some structure in the information to add to what we already know in the system, so we can generate this knowledge and exchange and improve all the decisions. So talking about the data, the principal term for us, especially for emergency attempt, is going to be the quality. The quality is a term, well, it's relative. There's two ways to see this type of terms. For example, there's two tools. In the right tool, we can see the technology, and the other one, we can see the hammer. It's more simple. So if I ask for the quality, well, it depends. If I want to make a statement into the wall, the hammer, it has more quality. So it depends. So the quality, it depends of the use you're going to make with the tool. The use is going to be made or decided by the user. So the objective is main important. So it will be a decision of the objective, and for the user is going to use the tool. So that's the type of consideration we must to take on. There's thousands of ways to investigate the qualities and to determine different type of qualities. So I want to comment different types of dimensions to define. I want to define all the principal ones that can contribute to the analysis, to the quality of the tools. It must to be accessible. It must to be useful. If we want to talk about the emergency attempt, the comparability of the results are really important. It must be precise, transparent, and with all the data information and monitoring all this information. So these are the most important type of dimensions we can talk when we talk about quality. Well, what we're going to do if if the quality is the definition of the attempt of emergency, what use are we going to bring to the table in this type of situations? In this emergency attempt, the most important thing is to bring all the symptoms on and take action before the emergency. So we must to take back on to the system, to the first status, the first step as soon as possible. So the main objective, the final objective of the response is to have all the information before it happens. All the information must be aligned before we take action, before the decision. So if we have this brought in this no vaccination zone, we must to take action sooner in compared to with a vaccination zone. So that's how we want to evaluate the zone and the information. So I want to present this figure, this image that brings all the information that I'm talking. For example, the stages of the response to our emergency. So for example, there's a stage where there's no cases, there's no emergency, where the moments are peaceful, Well, in some moment it will change to an alert when we have this type of risk with the disease. So we take action into the emergency. When we get to the point of the emergency, it change, for example, into the foot-mouth disease. So we change the type of response to this type of emergency. So the construction of the cycle changes in this emergency cycle. So for each stage, there's different type of actions we must to take on. So when we're talking about the peaceful moments where we don't have any emergency attempt, well, we must to prepare. So the prevention and the monitoring, it will be aligning all the time during all the cycle of the emergency. So when you have the change of the response in the first step with the preparing and the monitoring information, so that's the first step before the emergency. Know the information, we must align the analysis of the information to the vision that we want to take risk on. And so all the time, all the moment, each moment we must to bring all the information so we can monitor and control it. So in the peaceful stage, I have this task we do so we can develop. First of all, we know how the system will works. The different stages of the different cycle of the productive cycle and all the risk that can be taken. So we have different type of data analysis. Two of them are, for example, the introduction of the risk attempt, different entry route, different important type of dissemination. For example, it's associated of the peaceful times for evaluation of different routes of mobilization and type of preparation. For example, Brazil, when we started to discuss about the vaccine, we try to underneath all the information and see what type of route we need in this territory. So we understand about how this system can be work and how the actions has to be made in different type of stages during the cycle of emergency, but also in mathematic modeling, there's a big tool we can use. We can also estimate it and relate it. The different scenarios of emergency can be taken during an attempt. So we can try to understand how it will be the emergency in Santa Cruz, in Beni, in different contexts. So, for example, that context, it says how it's going to be involved the immunization and the routes we're going to take on. So that's why we have made here in Bolivia. It's a work being developed for almost a year or more, where we exactly did this. We examined the different type of boat and attempts of emergency, where the most important thing was the veterinarian attempt and the response of the risk that they made. So when we are in the stage of when we have passed the stage of preparation and monitoring and control, we now have the new stage of the change. So you can imagine that the alerts are on, for example, in Croatia, and they have this type of alerts where the scenario is changing. So we must understand how the monitoring system is going to work. The intelligence and the mathematical resources we use, they're also analyzing the different stages, the sensibility of the system. Also have this system and evaluate the capacity on how it's going to take on all the decisions as a human resources, as a financial resources, and how can estimate the capacity of laboratories and what we will need to improve and detect all the emergency stages. So we get to the emergency stage where the different roads and the mapping of the modeling mathematics we set in the system, identify the new areas and the type of veterinary resources we need. So the analysis of the different type of disease and the different type of modeling to make it more simple, so we can act quick, faster in an attempt of the emergency of the disease. For example, we have this monitoring of the contacts, so we can determine the different type of areas, the risk areas, and the type of emergency. So we can do this from the system, and we can take the different actions that we need to control the risk and emergency attempts. This is automatized in this type of systems because we have this list already made by the system, and it prioritizes the different type of regions and the type of risk in function of the area that we are trying to information. All this information also compiles and analyze the human resources that we need to deal with different type of diseases, not just in an area or risk type, but also in an emergency type of risk. In emergency moment, we need to contain and to understand how is the population and how the sustainability is going to be against the risk, the possible risk. So we must know all the population, all the area and the possibilities of the risk that are going to turn into emergency and the different scenarios. So before the emergency takes on, we must prepare the information. The information is really important, so we can take action and take it to the different structures and the possibilities and the different zones of contention with the objective of to end and not interrupt the productive chain and the supply chain. So in the cooperation stage, the final stage, we must to monitoring all the risk and how the response was taken. So the population and how the response was, so we can show the absence of the risk and the objective has been made and complete achieved. But also in this stage, we try to maintain the memory of the response. So all the information during the emergency is compiled and analyzed in function of the different type of data. It brings all the behavior of the risk and the territory that we have analyzed. But for all this, we need the data, the information. We need all the upgrades of the system, the special points, the areas, information of areas, the veterinarians, the part of risk, the lands, the epidemiology information, and all the health information we need for those areas. So we must understand this type of procedures is bringing information all the time. We're trying to analyze the information being generated during 24/7 the type of emergencies attempts, and this type of procedures now also brings the information to being evaluated or analyze the information, but also we must to take actions with this information. That's all. Thank you very much. And now, the next section, we say one of the tools that we have is to try to bring the modeling to understand the disease and the impact with the different tools. We have this expert in epidemiology that has been work with modeling. Not just for toast disease, but also a familiar disease. Fabian Gonzalez from the Washington University. He will be with us. He will be remotely. He bring a video to discuss all the information. I don't know if we have the opportunity to try to contact with him. I think we will talk with him. I don't know. But the interesting is that it's not just the experience, the expertise he has, but not just the expertise. Of course, you have been doing this journey when you were working here in Bolivia. You have been trying to make this journey with different type of improvements. It's really interesting you're here with us. You can talk and you have the microphone if you want to say hi, and we can see the video about you. Yeah, you haven't said that I'm Material from Gabriel Moreno. I'm a local researcher from Bolivia. So I don't know, I have the situation I couldn't have the trip to participate in this activity, but I'm glad I can be participating remotely and contribute to this activity and say hi to everyone. Okay, so we are going to show the video that you gave us for your presentation, so thank you. Okay, perfect. Good morning. I'm so sorry I couldn't be there. I would like to thank you to everyone who has been organizing this activity. I would love to show you how is the application and the modeling, the mathematical modeling will support the systems that we're trying to bring as a solution from the monitoring. So we already know that we have different zones with vaccination free. We hope that each country will be vaccination free and we will free from this disease. But also, it doesn't mean that we must relax about the subject. We know that disease won't end, so we must be aware. The vaccine are a really great example about how it could be the risk all the time. For example, this disease of lactosa fever. It has an advertisement about the risk and how to respond to them. So we try to improve the or it will be a new emergency. So all these type of scenarios are already screened into the agreements we have for this plan 2025 because of the expertise and experiences each country have been made during this time. What we have learned with all these experiences, the results weren't enough. We also know that the different type of risk can be modified and is not sustainable during time. So we must to see when it's effective and how it can be modified, and if it's necessary, we want to implement the new type of systems. Because the data we have is really minimum, and we must to monitoring all the time. The type of stages can be changed all the time. So what happens if the vaccination doesn't last for the rest of the species, for example, or they need a modification for the plan? We also have learned the evolution of the different systems and that we needed more information and control and monitoring. We have learned, but also that we were talking about cold population, a virgin population of livestock. We needed a new vaccination stage with new technology and improvement of the doses. So if we make a different simulation of the reaction of the disease, maybe we will show a new effective way to eradicate the disease, but also we can ask the new strategies we can try into the new population, or how can, or if the vaccination will be enough for the different stages of emergency. Those type of questions are really needed into our plan. All this information, we can also contribute to the information and be monitoring the new consequences and the new questions. So what's the best way to take action? Our experience and our monitoring need more information and no new monitoring system because of the last type of reaction. When we're talking about veterinary and agricultural sector, we know that there's always new changes. We have new models, epidemiological models. These models can be upgraded so we can identify the new consequences, but also to see how can prevent the new type of changes in real time. So all the information that brings into the system can be useful for new models, new economic models. and we can advance it in economic models to bring new useful use for the resources, financial resources. I will bring some examples about the application of the changes into a system. For example, this is a map of the epidemiological map. There was a prevention term work with some of the institutions. So I will ask to you, for example, this map just bring the information of the zones and what type of risk they are bringing, where the properties or the infections were with a high risk into epidemiological studies. So it wasn't sustainable during time. So we needed changes. And if the epidemic disease was, for example, in gray, it was with different type of changes and different species. So the information was crucial. If we have the details in real time, we also can see if these cases will have new changes. This model will help us to prioritize the new type of changes and risk, for example, in the red ones, and according to the map, will bring in new consequences and told us if the function was working or not. So I was prioritizing with this map the functions and the risk during these zones. So in a peaceful time, we can compare the new strategies with the last ones to upgrade the new plan, the emergency plan. This also was a prevention work from Victoria to compare different type of strategies so we can apply the control to epidemic, to compare the strategies, the results, but also the type of epidemic, the number of affected, the number of where was eradicated the disease, and the data of the affected animals. So we are comparing all the information and different scenarios, comparing with the simple and basic scenario. And these different type of scenarios bring new information. For example, around a farm, we see that there's different type of animals and species, so we can also analyze how each species can be reacting, and what can we apply to solve the challenges and upgrade the different vaccination system, based on the species and the information we are comparing, especially for the high risk epidemic transition and transmission species. Now, have made all this mapping system and evaluated all the information, comparing in real time with a program for the plan of emergency. Is questioning in detail each information, each data during an epidemic. This is an example of the publishment about the investigation, where we have demonstrated that in the moment that we detect the first farm with mouth-throat disease, there was already a lot of farms infected, especially for the red point. There were zones where already had the disease. So that was because of the movement of animal movement and the migration of each species during along the country. Victoria is also evaluating the type of migration and what was the risk of vaccination they had for each expedition. We are showing each result where the vaccination was affected, and in different dates we have the reaction, and the timeline shows how the vaccination, for example, after a week the vaccination was reacted, but the infected animals were already more than 60%. But that was 1 week after the monitoring, adding also the movement and the migration of the species. So, but we are trying to talk about just one doses about the vaccine, but now all the information was analyzed during the pandemic, for example, to see and comparing all the results in a different type of modeling to take a new steps into a strategy. Just because one farm was analyzed and compared. So that was a different type of stages and risk that one farm could bring to the animal population. And the math modeling can bring also new stages, new type of data and information, the size, and different upgrades to see and evaluate that allows how can we improve the information to the current situation. Can bring different type of countries. For example, different countries can bring different contexts of the vaccine estimate population. So if we bring a new team of vaccination and we can prepare and control a new system, we're already trying to do it, and we hope you can also use this type of improvements and use this type of systems where you can have the information, have a map, maybe in a specific way because of the different type of context, and upload and choose which disease do you want to analyze. This is an example. For example, we have this type of maps. If you want to apply it into your countries, and you can also choose the parameters and the conditions that you want to study, and it will bring the new comparison and the new data to help how to analyze the information that you already have. And well, in conclusion, how you can control an emergency? Well, learning from the last epidemics and the expertise and the experiences before an emergency. And once you have the math modeling, and you can also bring a simulation of different stages of risk depending of the context to apply in each country in a better and faster way, in most cases an effective way. And important is that we must to upgrade of the prevention plans with technology, and upgrading with the knowledge, and also the supply changes and the productive change. I want to thank you to the guys who works on the system and developing and codifying the technology that we need to use the information correctly. They were very useful for the procedures. Thank you very much.
Our next panelist is also a person from here. It's a local, Dr. Daniel Gareca from Senasac, and he's going to talk about the strategies of preparation for emergencies in answering here in Bolivia. Thanks, Danny. Thanks a lot. Good morning, everyone. Warm welcome to all of you. Continuing with this round of presentations in this session, I am going to present the experiences and advances that Bolivia has had in this new scenario of as a country free of vaccines, considering and directing toward emergency strategy in Bolivia. Okay. In order to introduce what is the implementation in Bolivia, it's important to do a brief summary historic what was foot and mouth disease in Bolivia through this publication that is made by Orlando Aguirre that narrates the history of foot and mouth disease in Bolivia. And he details in what was the behavior of the disease since its beginnings. We see in 2012 was the first outbreak in the department of Cochabamba. After that, in the decades of the 60s, more viruses were typified that were affecting the country with the support of the Pan American Center against the foot and mouth disease. And during the decade of the 70s, also with the implementation of programs of animal health, just like the institutions of FAO, and the first service, we can say in 1976, which was rabia brucellosis and foot and mouth in Cochabamba. Then in 1997, we have the prefecturates, which are now the governed nations, and with the support of the university in order to be able to work in topics of foot and mouth disease, especially in the studies of control of the outbreaks during that era. Well, as you very well know, in 2001, the foot and mouth program in Bolivia was created, along with the creation of the SENASAC. And in that era, in 2001, the country had 144 outbreaks of foot and mouth disease. And after that, once these strategies are implemented in between 2002 and 2003, the outbreaks were reduced to 17 and 18, in which we can observe in that slide the areas affected in our country. And as I mentioned before, the last outbreak of foot and mouth was in the year 2007, here precisely in the department of Santa Cruz. And so all this situation made that the program against foot and mouth disease develop programs of prevention and also preventions of emergencies, considering that disease was present, affecting a large area of the territory. Okay, going into sanitary emergencies, what have we done as veterinarian services and as a program of foot and mouth disease? Firstly, establish a national system of animal welfare, which have a series of subsystems. And what we look with these systems is to regulate animal welfare in Bolivia and also the attention of foot and mouth disease outbreaks through the CNAS. These systems establishes the directories of the SENI animal. When I talk about this system, I'm not only talking about the SENASAC, but also the veterinarian structure of the private sector. So between public and private sectors, we face all these subsystems in order to control the diseases, amongst them foot and mouth disease, and also to have a system of for emergencies for contagious diseases like foot and mouth disease. Okay. Within what we have, the prevention, so sanitary, is indicated that we have to have an organization So it has to be part of the management and coordinations of the emergencies and the coordination intersectional in order to attend these emergencies. It's also very important the participation of the political responsibles due to the fact that if one of these strategies it doesn't come with the support of the political leader, which is very important in the implementation and gathering of resources, is very unlikely that the management could be effective. And finally, to define the priorities and strategies. Here, once again, I show the same slide that Daniel showed you, in which you can appreciate and see all the different actions that need to be taken during each of the stages that Daniel presented in a very detailed fashion. By going into emergency management in the times of peace, in the preparation predominates, as you can see there, the activities of preparations way far of the other. And also, the colleagues of FAO also mention and elaborate an emergency preparation cycle, which includes planification, equipment, formation, and proof. And each one of them describe a series of elements that must be taken into consideration in order to be able to prepare the system of emergencies facing some outbreak, in this case of foot and mouth. So our country has also adopted this cycle of preparation that allows us to be able to update our plans of contingency and emergency. And so from using this tool, we can say that also it has been used. Okay, this I'm going to show you because it's important. It's a new scenario that we are also facing the private sector in our country. All the advances that we have had in the topic of eradication of diseases. So it's very important as well to consider all this because it's a new scenario in which we must be prepared, as Dr. José Luis mentioned, for possible incursions of diseases, for example, for the mouse. As I was saying, according to the cycle of emergency management, as a country member of the, we also have had in which we have applied, which is also a tool that is part of the guides for the preparation of emergencies that FAO has, and in which we describe that we have auto-evaluations from their contingency plans or their activities that are required in order to be prepared facing an emergency. Considering that tool and this auditory that we had with the Community of Nations and the 4 country members of the CAN, we have evaluated these six criteria, let's say, that the cycles of preparation for emergencies consider it that are the general procedures for the management of animal diseases, risk management, generic plans for emergencies, and communication and participation of the community. And these have been the results that this auditory has presented. As you can see, we consider that all the countries in the region are not foreign to these results, and in big part of the criteria that has been evaluated, that this tool allow us to do the auto-evaluation. We have gathered levels, except in a partial way, which are the generic plans and a specific of answer for foot and mouth. So with this tool, we as a veterinarian service, it gave us a better orientation in which we need to make adjustments in our emergency system in order to be better prepared facing a new possible outbreak, in this case of foot and mouth. So this is a very important tool for us, and so we can do the necessary adjustments in our emergency and contingency plans. And the other cycle
the FAO prepared is equipment in which we have trained resources that have participated in emergencies. However, it's very important to keep them updated precisely in terms of drills and preparing emergencies. Also, must be, according to us, this auditory that we have the results, we need to strengthen the identifications of professionals. In other words, to have a group of people that have expertise in this type of emergencies. And also we have equipment for the attention of emergencies guaranteed with a budget from the SENASA mainly, and we also with the emergency funds, just like our colleague from the private sector explained, we have agreements in order to generate these emergency funds that are going to be very useful at the moment when we are facing an emergency. It's also important to have vaccines in a situation of emergency. We are trying to do the agreements with the Bank of Vaccines. Also, the auditory indicates that they have periodic times for the preparation of the staff. So we consider this a strength from the veterinary system. Capacitations and evaluation of capacities plans must be strengthened, even though there are big capacitations, they are not framed. So we also need to work in order to be prepared for an emergency. So our staff is prepared. The exercises of testing are also done periodically. And finally, it's important to have an integrated plan of emergency, considering diseases in which another actors must participate, like the environment, for example. So we need to have integrated plans of preparation for emergencies. As you can see, we have been doing all this work with the Veterinarian Service of Bolivia, so we can determine our emergency sanitary system when facing a possible outbreak of foot-and-mouth disease. It's also important to highlight here, just like the people that talked before, doing drills is a very important tool in which we have applied tools of simulation developed by the University of North Carolina. And obviously, the Bolivian Veterinarian Service has participated in this work, and it has shown important results. I want to share with you. It's just like Daniel mentioned before, without data we cannot model anything. But I want to move a little bit before Daniel. Who generates the data are field veterinarians. So if we don't have field veterinarians, so who are the people that collect the data? Without data, there is no simulation. So I want to praise that job here in the veterinarians, because they are the ones that are in the field and they generate all this data. And many times they don't see the magnitude of their work. So we hear the importance of their work at the moment of collecting good data, which allowed us to do for their country. So we have the introduction of bovines, and also the displacement of animals in the whole country. So the modeling can do the respective runs and simulate the outbreaks of foot-and-mouth disease. It's in this way that these are the results of the simulated outbreaks, and that the model has. This is a geographic distribution modeling that we can see in the map. For example, the intensity, those municipalities, in most of the simulated, we have done this for foot-and-mouth disease. And these are the rings that have been simulated for the control activities, infected, focal, and surveillance area. So all the parameters are introduced in the model, so the model can generate all these results. And also calls my attention that the simulations, if we see the real outbreaks in which, in some ways, the simulated allows us to see and allows us to work in preparing for an emergency. Despite the fact that they are not exact, they give us a very good idea of how the outbreaks may present themselves. That's very important in times of peace. For when the real emergency occurs, just like the graphic show, we are prepared and we can perform in a more effective way. Continuing with the results of the work of simulation, 5 scenarios have been simulated, which we can see between 1 and 2 we consider as a veterinary service that may be the most effective, as you can see in the results, applying emergency vaccinations and sacrificing the population. So we have a control of the outbreak above 65% in 2 scenarios, and the duration of the outbreaks in 27 days. In a scenario of 236,000 doses. In the other scenarios, we also can analyze. However, we consider that the scenarios, the 1 and 2 scenario, are the most adequate to consider in the updating of our plans of contingency. And if you can see, the scenario number 5 is the most effective, with 100% of the outbreaks controlled. But also we need to consider that the killing of animals increases, and we also need to consider this from the economical point of view. So we need to see if our emergency fund will be able to tolerate all that. So this is very important in order for us to be able to prepare our emergency plans. Faster. Well, okay, this is the last slide to finish. And also I would like to indicate that all these results, as you can see, we as a service allows us, because this graphic on the right has always been discussed with the private sector, which strategy to use. So with the simulating model, allows us a little bit to see clear the panorama, what way to follow at the time of choosing what plan of actions to use. Okay. To conclude, indicate that Bolivia has reached optimal development levels to face emergencies for foot-and-mouth disease. We have technological instruments that allows us, and other specifics as an answer. The modeling promote a better in peacetime. Bolivia has advanced in private and public, so the confirmation of emergency funds for foot-and-mouth disease and the intervention strategies which lives. Okay, thank you very much for your attention. Thanks. Okay, just to say, if we are going to get the certification as a free country, is a satisfaction. Also, I would like to inform that this year the SENASAC is celebrating the 25th anniversary, so it's a double celebration for us this year. Thank you very much. And to conclude this session, we are going to have a Guaraya from the, they know from since the time they eradicate foot-and-mouth in the 80s, it's almost 40 years. So we're going to learn a little bit of what they have been doing. I don't know where he is. Okay, there he is. I was looking for you. Thanks, Hugo.
Good afternoon, everyone. First of all, I want to be thankful for the invitation for NAFTOSA FSF for SENASAC directive. And also, we have received this invitation, but also I want to invite you to Chile. Something happened. Look, Chile, look what we have. To see our amazing landscapes.
Hoy te contamos de nosotros.
While we tell about us.
Del talento de chilenas y chilenos. Estamos creando el futuro acá.
The talent of
desde el extremo sur
Chile.
del mundo. Donde lo imposible es
Where the
posible.
impossible is possible.
Haciendo que las cosas pasen.
Making things
La
happen.
energía de esta tierra nos ha dado
The
tanto
energy of this earth
durante
has
tanto
bring a lot to us during a lot of time.
Por eso, te invitamos a ayudarnos
That's
declarando
why
los productos de
I invite
origen
you
animal que traes en tu equipaje. Pues pueden poner en riesgo nuestra
to tackle the
agricultura,
products,
la flora y
the
fauna
animal
que existen en
and
nuestro país,
the
que
fauna's
protegemos
product
cada día
that
para
we
crear el futuro que
prevent
estamos.
and protect every day.
Completa el formulario de declaración
Complete
jurada
the
digital SAC
form
o en los formatos impresos disponibles
or
en
the
el
different
portal
formats
de
that are
nuestro país.
available
Porque
in
deberás
every
recibir
control
o
land.
entregar este documento al personal SAC
So you
habilitado en tu
can
país.
bring the information to the control
Si tienes
police.
dudas de qué declarar,
If you have
siempre declara
doubt
sí. No te arriesgues.
and what
Evita
type of
sanciones.
control we
Un personal
have,
especializado
you can
de
also ask
protección
to
de
a
colega
specialist
te ayudará.
in the
Gracias
SAC
al excelente
equipment.
estándar de sanidad vegetal y animal, es que
Thanks to
podemos
the
ofrecer
standard
productos de la
equipment,
más alta calidad al mundo.
and that's why
Por
we
eso,
can bring the
declara
best
y cuidemos
products
juntos la
worldwide.
naturaleza que te recibe.
So let's bring us
¿De qué
together
incluye?
to
Nosotros vemos
and
que
join
hay
us
todo
to
un mundo por
protect
delante.
the different type of products.
Y tenemos tanto para aportar al mundo.
We have a lot to bring to the world, so we are really anxious to see how far we can go.
Chile es la experiencia del extremo sur del mundo, que te invita a crear juntos
Live the
un futuro
experience
mejor.
of the south of Chile.
Creando futuro.
As you can see in the view, the strength of Chile is the natural resources. That's where our role is as a veterinarian. And why the veterinarian services exist? Because we have to obligate different obligation and mandatory laws. For example, the first stage is prevent. So that's what the previous presentations asked me, what we can do to prevent the different exotic disease. We have another challenge to control different diseases or different diseases that are already in our country to reduce them. Some exotic disease, we are working, for example, for the cirrhosis vena disease. We have improved our stage, but we want to go far from that. And some of the objectives are not taking action on, but the main objective is to eradicate the disease. So in the 80s, Chile have eradicated this exotic disease, the PREs, the avian influenza, and we keep going to keep this cycle that today the world demands to Chile. Some of the meetings that I have been with, they said that Chile takes itself because we have the desert, we have in the east side we have this mountain tribe and the ocean, and for the south, so we have these mines. Well, some of the countries say that Chile has this natural protection around the country. But that's not enough. We also need a new a new security way to complement. My way to explain and visualize all this plan is how to embrace a red as a strength, like we strength each red within a cycle to hold all the main challenges. For example, as we veterinarian, we try to implement as a complement of these natural resources, try to guarantee the safety and sanity into the health area. This is not involved just with the SAC institution, but also the institutions as another countries have another institutions. We have seen this different type of risk. I made this curse or we saw this type of movement and the increment of the different type of exotic diseases with different type of risk that we still don't know. So we want to integrate that information, and that's why OPS and COSALFA is a big and important, is playing a big and important role. So I want to present how this red, the global red, brings to this planet long and poor planet. We have this trend in the laws that for many years bring us some tools to take actions and decisions for the security as a country requires, and we want to uh, implement. But each country is independent to take any type of decision against any risk. So I won't be very detailed into these normatives, but there are some norms and rules we get in this country. For example, to prevent, to control, and eradicate. This is our main objective against this disease. So how we can implement these actions? We have invade. Something happened. I'm talking too much, I guess. We invented this our system, our healthy system in three main important pillars. The prevention, the control, and this is not different compared to another country. We try to improve the comparison and communication into each pillar. Each pillar doesn't work for itself. We have to strengthen it between them as a red. So in the first pillar, what we do, the base is the regulation, because we have these universal norms where the international laws is also publishing the type of regulations each country must to demand. Those are official, for example, for the OASIS pages, but also the non-officials as the news, or we must to confirm or deny each of the news and information, but also controlling the exploitation and information of the material and resources. Another country or different countries takes some sanitary information about us, so we can see if another markets can also set the asset. The second participation, for example, it's with rounds and discussions in international activities. For example, today we participate in the American activities with Carlos, is vice president, for example, my colleague, and the provision of the normative. But in the techniques and the recognition of another countries, we also send some human resources to make the comparison and to agree with Chile, have new agreements to recognize these new type of tools and systems. For example, Brazil recognized the new stages and new zones to make the supply chain bigger and evaluate the new delegations with new markets where we have a commercial history. Last year we visited Canada and we saw the systems, also Australia, Brazil was one of the most challenging country. Bolivia, we recognize some of the healthy certificates in Switzerland. What we do, especially once we have the information, we send our equipment and teams to analyze the different norms and normatives and information of the cattlemen and agropecuarian sectors. As a security level, we have complementary norms and laws, so we compare those and to analyze. So the second pillar says to take action in the landing and oceanic and different stations for livestock to implement the new risk and to verify the compliance and inspection into the supply chain and to analyze the different type of animals that get into our country. We control into the land where our equipment and teams that are always we join with our animals, our dogs, that analyze the type of supply chain and the commercial exchange, where the international suspension sector also has a monitoring system where we try to improve the equipments and the different type of merchandise where we exchange with different type of countries. Each of them has a laboratory to analyze and inspect all the tools they have. And the last pillar also is the post-information monitoring, where the government is not allowed to analyze, but we see if the landscape and how they kill the animals, particularly how the disease and immunology and epidemiologic data information is analyzed. We also have this program that improves how our livestock sales as an exchange into the other countries and how the exchange is going to be modeling around to prevent any disease they can bring in our livestock that brings into our country. Also, we develop different type of programs and systems to monitoring and control to see of the exportation also. So we can all bring all this together as just monitoring and control and fiscalization to have a diagnosis of the different exchange. So our work in this field, in the countryside with our programs and the attention of demand, we must to make some improvements and for the installations in the mobile banks, because there's no many type of resources, not just for the kids, but also the enrollment, but also the translation and a system to the south, to the north of the country. A new team of veterinarians as human resources that can also report frequently the different type of information of the exchange and the different immunologic system. Also, our laboratories is a guarantee to have the diagnosis with qualified instruments and tools for the information. This is just possible because the commitment of our country. So I hope this services is also improved during the time. But the veterinarian services are not just all alone. There's a whole system for it, for the cattlemen and agropecuarian sector. We can have a lot of actions and decisions, but it's necessary to have the constant capacitation to our teams and institutions that are relevant to our improvement. For example, the last simulation of this type of disease that made in Portugal, where our teams are prepared in a technology as a human level. We can improve dividing into groups as a simulation of the different type of challenges and how they can react and take action during the risk, because the rhythm that we have, it was really slow because administration behind it, but we now improve all that in two groups. But that's not enough. SOX says is good. It's like when you have a kid and you say that your kid is doing great, but it's also necessary that some institution regulates and it has a constant control to it. In this procedure, the new team that controls and monitoring the official laboratories, they have try to monitoring the different type of controls and systems, the laboratory, the private laboratories, the new regional offices, the metropolitan offices, and the department offices, the exchange of medicine and animal products, and then another regional office. Well, the results are really great because it says that the evaluation of this institution, of the evaluation the last year we have made, it says that in general terms, it says there are high quality information, and this of course confirms that the great job you are doing. But also the achievement of the ASA is not just of Carolina or Waraya regional control, but also it's been improving for 75 years, 77 years. I don't know what happened. And well, with all this information, what we do? Well, we take action, we made some decisions, also thinking in the condition as a free vaccine country of foot mouth disease, also the external international exchange and supply chain commercial relationship. Thank you very much. Now, all the participants, I want to invite you to the seats. We have 20 minutes to answer some questions for some of you. Hugo, Daniel, and we can connect by video call to Jose Gonzalez. Can you hear us, Jose? Okay, perfect. I want to take some of the Wi-Fi red. Is Salón Chiquitano, and the password is Facebook Cruz Eventos. The F it's in major. Salón Chiquitano is the name of the Wi-Fi, because some of you won't have any trouble to connect to this red. Okay, so if everyone has the red, okay, we can go back to the Jose Manuel's video. Okay, thank you. Okay, Daniel Magallanes, we will start with you. There is this question: what's the frequency that we must to have for the animal registration? Well, Manuel, there's no recipe for anything. There's no there's there, there's no indicator that exists. It has to be the utility of the data and information. So I comment an example. Sometimes there's a migration of animals that change the type of quantity. So it's normal, you know. You don't have a type of problem, but the idea is to always keep upgrading the information, because when we have a lot of information or without details, without being updated, so it depends what's the use of the information. But if it's an information yearly updated and upgrading, if you have a new evaluation, more detailed, more heavy, it demands more information, for example, new decisions for specific areas or for new type of monitoring or more specific information, of course we must to be more specific and have a monitoring, a more frequent monitoring. Yeah. Well, of course, and it depends, right? The dynamic between the population and the area and the zone. So, Jose, you have present this tool that we are trying to develop to make a simulation with a mapping. Uh, that will be able to be useful for different type of disease, maybe toes, foot mouth disease. Can you be more specific? Well, our idea is to include that idea this year and with a free access. But yeah, that will be just making these maps, these risk maps, the mapping, because making the simulation of epidemics, it will be more long. If you want to be making that remotely, it will be depend the zone and the area. At least we want to be able to bring some access to the information to create some risk maps. So we have this available at the end of this year, and maybe the parameters. Okay, when we defend their thesis, that will be already available. When you want to make some risk, yeah, I think there will be included some parameters, and they will be included to analyze some parameters for the mapping. Yeah, that's the idea. You can bring some different type of parameters to show different type of mappings, principally for the European communities, some Asian communities, countries, Thailand, yeah. And yeah, we will bring the information with very specific parameters. So Daniel Gareca, some of them were asking, how is the how is defined the strategies for Bolivia, and how you can involve the private sector as the public sector to the strategic? Well, thank you. As I was showing to the presentation, with this tool, the simulation for us as a public sector and for also for the technical sector, it will be a facilitator and make it easier as to show how the disease will bring an increasement, but also the timeline. So the scenarios are really specific, so we can take action and we can take the best scenarios considering the different migration and mobilization of the animals. The two stages, the two scenarios of the institution will bring us a new strategy for the vaccination and to try to build a plan for 3 months maximum for each attempt of emergency. Also, the private sector, as the Jerry Sensano said, in this preparation stage is really advanced because of the agreements to obtain the different type of financial researches to research new type of plans in our new emergency stage. Yeah, perfect. Ugo, they are asking if this traceability system you can please explain how it consists. Okay, yeah, of course. So we have this traceability system that it's individual in short term for swine, uh, but if track into two groups individual because of the practice, you can't associate an animal to an area, so we can associate it depending the characteristics and the information. So that allows to make a procedure and management how can it potentially move, or which animals or which group of animals can be involved. So this is because of the new platform, CPEC platform. So each user has the obligation to register each animal that brings into the farms. For example, today we have this traceability before the first movement. We must to have the alert and the register of the type of animal, and we try to bring the information to adjust during the time with new advanced technologies or maybe new devices, so we can try to, for example, radio frequency systems to show a new and faster type of monitoring of the movement of animals. Or, for example, the sanitarian sector is also been monitoring the type of activities they are making. Okay, thank you. They are asking also in the chat how you can work without the information. I will ask this to Daniel. The risk, the analysis risk, and the complementary information. Also, we want to know the analysis, the modeling, and the simulations of databases, but how you can comment from your expertise and point of view, as also Jose, what strategy do you have? How important is to take the information. We know that we have this information like in different type of contexts, in different countries. The quality of information depends of the country, but it depends for the use. For the use. So the evolution of the information is because of the use. If this enough between the difference and the lack of parameters, and into that we must evaluate the low quality information. So that's already a diagnosis, but we must understand if this is bad or good. We also understand how the system works and how you did get to this information. So I think we must start the evaluation of the information if this is a bad quality or a good quality. If we don't evaluate this type of information, it's not useful. So this is really hard because sometimes the information is not too specific or is not of a high quality because it's difficult to get, but the difference is really important. Yeah. Thank you, Daniel. Jose, can you complement the answer of the vision about this point? So yeah, Daniel is really optimistic. If we don't have the data, how we can work with the operations? Like, I think without data, we can't work. So this is the emphasis of the importance of the maintaining the information and the type of information that we will need, not just for the analysis, but also the management of the monitoring and the introduction of data. So Daniel Sanazak, they are asking, I think you mentioned in this, but this question it says, where are you going to build this vaccine into Bolivia? Like, how are you going to create it? Yeah, we have just defined a new agreement with the vaccine bank. Panaftosa is leading this agreement. So we are trying to work with as a service to achieve this type of agreement with the country. So we are trying to make the management and all the procedures to agree with this type of emergency type. So you think that you want to add to this bank? So this interesting question we have as we also know that SAC has the capacity to eradicate and mitigate all the risk, but we also want to know how is the stability of the veterinarian sector and the veterinary of the SAC. Is this contributing to the new services? How you can comment this? Yeah. That's a really interesting point because we're just public functionaries. This is not normal, it's not strange. We do a start point and a final point. It's not just the continuity, but also the work and the story, the fact that we can share and how this director have worked with this diagnosis. You know, like you can continue with this legacy of history and the commitment, more than just the work you put in. So this is a guarantee. We know that there's a lot of rotation in the veterinarian sector, but we keep being a service of the early professionals wants to lead. So if they want to be there, the first competition is also the industrial competition. But if we keep and retain all the new talent for the next 7 years, I think we will get to it. Yeah, we are with a delay. We must to close this session. This point of view will be it's been a really impressive. I must apologize about the type of advance we have made. The timeline was really short. I want to thank to everyone here, to Jose. We are with time and 6 different time hour. This delay, I'm sorry. Jose, if you want to say something, we are closing the session. Well, I want to congratulate the region. They have improved everything about the foot-mouth disease. That doesn't mean that we must relax. We must to keep going. There's a long way, as we can see, as Chile have made. The level of traceability in the movines are really impressive, but we must improve in the region, keeping those movements forward. Yeah, Jose, I want to thank to the person that have made the questions. If someone says if they know the start point of the German epidemic session point, but yeah, maybe some of them they will tell us something, the origin of it. Maybe we don't know, but they will talk about it. Some of the questions were also, I'm sorry if I didn't read them all, But the risk paralysis also was a question important. We are also having this new project to analyze the type of risk to capacitate and teach to the other countries with ORISA, for example, Central America, South America, and the support of the Visa California University. There's another country also. There's a lot of countries that are informed about this type of projects, the launching of it. So I'm closing the session. Thank you to everyone. I don't know if Anna is going to make the announcement. Okay, Anna, thank you. So this is the time of the recess. I guess some of you want to have lunch. The bad news is there's a storm outside. The nearest restaurant is Novotel, and also the personnel here will inform you how to get to the restaurant. There's a new menu for 90 bolivianos. So of course you can go to it to everywhere you want, but there's the nearest place to go. So the personnel that are here will help you with the location, and we will
Y cuando toqué que agua de Paulo y por tus barrios y una moza en el balcón suspiraba. Como me acuerdo el barrio en la capilla, el río Telchi y el barrio Cerebón. Como me acuerdo de la calle Murillo, donde nació Gladys, orgullo nacional. El Arenal también lleva en el alma un pedacito del recuerdo del ayer. La Catedral, San Francisco y la Merced son mudos testigos
Hola, hola, sí, 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 sí.
Good afternoon to everyone. I hope everyone has an excellent lunch anywhere you have lunch. Please, I ask you to continue the event. The International Seminar of PRE-COSALFA. We're going to start with the third session. Also, we're going to have an interesting discussion. Please take seat, and we can proceed to the next session, please. In this new session, we're going to talk about the initiatives of the different regions to improve for a free vaccine vaccination country. Our estimate mate, Elmer Figueredo Marquez, will be joining us to moderate this new session. Guillermo, please. Good afternoon. Thank you, Maristela, for the applause. Oh, thank you, Gabriel. Good afternoon to everyone. I hope you had an excellent lunch, and I hope everyone is awake for this session. It's an honor receiving you in this third session for this international seminar in PRE-COSALFA, where we're going to be focusing the next subject, regional strategies to eradication for the foot and mouth disease. As you know, every country has a different discussion to tell. We have reflected about the challenge and the struggles and the opportunities for the transition for a free, healthy, sanity system, free vaccine. This transformation demands a planification and a cooperation, international cooperation, and a strengthening of capacities, external capacities for each one. On this occasion, we're going to analyze each regional initiatives that are key to facilitate all the management along different cases and experiences. I will start with the discussion, the theories discussions, and the scientific investigations, and the impact of, and analysis of the impact and the benefits, if it's beneficial, or where I have to go for a vaccine, especially for the private sector. As also the serious expectative of the sustainability for this road, this management, as we must start, as we demonstrate a lot of countries achieved the vaccination, the free vaccination zone, as we said in different occasions, as in Paris, but other countries must work and improve the plans and strategies and the capacity to improve the plan. So to start this session, I'm going to welcome to the Dr. Elizabeth Salas Torres as a representative of Abrocalidad, Ecuador, who is going to share with us the findings and the evaluation of the risk about the foot-mouth diseases and the investigation for the design of politics and design that can be implemented in an efficient way. Thank you, everyone. Welcome, Doctor. Good afternoon to everyone. Well, my presentation is focused in the regional initiative for the transition to okay, thank you. Wait. First of all, I want to start with a resume about the timeline of the food toast disease in Ecuador. In 1946 was the first apparition of this disease. Ecuador was a member of the OEA, as we know today as OMS. One of the normatives, the 1471, it was the first time was implemented the foot-mouth disease, and in 1979, it created a commission of the eradication for foot-toes disease. In 2008, we changed this commission for the agrocalidad, name it to Ecuador, and this started as a priority with the project of eradication of the foot-mouth diseases implemented with NCADES. That this is what emblematic for the country. In 2004 and 2012, to the 2nd of October, we can eradicate this disease. And CONEFA also implemented the project as a simulation of the whole program. So in 2014, we made some studies about the circulation as long as was along the country. This was really important, so allow us to declare as free vaccine country zone without vaccine in the Galapagos city. As you can see, this is the historical analysis diagnosis since 2005 until 2015. As you know, in 2012, there wasn't any sign of this disease in the country. So, with all the work along in a technical level, with also the international support, we could certificate as a free vaccine disease, foot and mouth disease country. So at first we had this certificate for the control and the diagnosis, and also the certification of the healthy in Galapagos and Ecuador's country. Since then, we have the situation in this platform Wajisonsa as a non-diagnosis disease since August 2011. Here we have this resume. Of the monitoring and control about this disease since 2012, since the certification. In 2015, we made these studies about along the country, and 2016 about the control of distribution along the country, as you see in the green color, but also in 2017 the circulation in the Occident zone, but also in the Oriental zone. In 2018, the immunity studies. In 2019, also the Occidental studies about the immunology and the circulation about the North zone and the Occidental zone, and the circulation in the South zone. And the last studies we executed was in 2024 in Central zone. Here, as we agrocalidad, we also monitoring and we focus this monitoring into healthy monitoring. I want to focus the commitment of the technicians and the team members that are in the field, our first field, because they execute the monitoring, the notification, and they recollect the information epidemiologic for a study, clinical studies. We also have this early alert since 2017. We also have this laboratory from the agency where we made the diagnosis, all the necessaries to prove and show all the virality of the laboratories. But also with all this information now that we have currently and advance about the improvements, we also know that we must to make an important diagnosis risk. The objective of this evaluation was to evaluate the difference between the type of heterotoxa in Ecuador from different routes. So one of the specific objectives was to evaluate the risk in Ecuador, but also the keys and the real zones in a specific way as a different type of diagnosis. In these three of scenarios, we can differentiate different scenarios of the probabilities of introduction of the disease. First of all, we must evaluate the supervivencial status of the disease, but for that we must to analyze the probability of heratosa in the origin of the disease, and we obtain that from the WACIs. But also we monitoring the origin country where we extract the information from the WACIs, but also all the supply chain and the assets we import into the country. Along the we extract this information from the platforms of commercial exchanges to the country. Also the migration issues and the status of the incautiation during our port and the exchanges that the country currently manage. We can also determine the type of animal that we export in the exchange that can possibly have the disease, but also the supervivency and the lead to the procedure of the disease to know how long it could stay the virus. But also the detection in farm with different type of food and healthy food and different supply of exchanges in the north zone and the south zone. We ask for help for the Ministry of Health and also the land and the strong forces, military forces, so we can also work as a team to detect the virus and see how is the contact with the different exotic animals against the entry of the disease along the country. Our base of data is the planted land of this website of the agency. The base data, human data, is from the migration data, but also the platform that I've told you before. There's a lot of investigations from the strong forces, but also the police from the north zone, but also the south zone. It was consulted for the monitoring health insurance, but also the Davis University for the analysis of the information. In this form, we had 8,000 answers, and one of the questions was, what do you think about the contribution of the increasement of the migration and exchange in supplies? And in this chart, we principally have the livestock and also the food for animal and the different type of animals, depending the type of animals we were talking. Porcines, swine. We estimate the percent of the introduction of management of the livestock and the destiny of this exchange, and which region could probably be related. So the results were that are still being perceived, but we have this previous response, but we must to evaluate those answers. So in conclusion, Why is this transition of status so important? Because of the beneficial economical resources, it reduces the prices, but also the competition in the exchange supplies, commerce, but also the animal health. And this transition can also help to the management, and it can improve the strengthening in the monitoring epidemiological studies, also the international cooperation and the studies along the country, maybe open wide this new exchange route with another countries and improves the competition with another countries. And talking about the competition with another countries, this requires that we always upgrade and upload all the information all along. But also we need different type of politics, because the politics we already have, we can execute new initiatives and procedures to collaborate in an international way. This international and institutional cooperation with different countries can also be really successful if we demand and focus this transition in a best way. We are trying to execute the cooperation as Agrocalidad along the coordination with the health coordinator. We could have coordinated and require and upload all the information. Also, Apanatosa has helped us with the logistics and the techniques, but also with the Davis University and the Dr. Martinez and Dr. Davis also help us to upload all the information to the studies. This is what I had prepared for you. Thank you very much.
Excellent. I would like to thank to Dr. Roana for respecting the times and bringing forward all that important information of all that work that is so important for a country that has the same reality as my city, and they changed for this city to be free with vaccination, and now they are looking for sustentations to make a jump forward without vaccination. Now we welcome Dr. Maristela Fitosa, and she's going to present us some of the works of the Technical Commission Panafitoso, which is called Rapid Test Development for the Implementation in Emergency Scenarios. And so I invite you to formulate your questions through the application so we can have a more detailed discussion. Okay, here is Dr. Maricela. Thanks. Bueno, good afternoon, everyone. It's an enormous pleasure to be in here in Santa Cruz de la Sierra, participating in this wonderful seminar. This is the third time I've been here, but always with the same welcoming. Thanks so much. I am going to talk about projects with Panaftosa as a technical cooperation activity. In order to be true, we have 6 projects, and I have to select only one because of the limited time allotment that we have. In all the projects that the people done is about the demand of the countries as a technical support. The project that was selected was the validation of commercial testing lateral flow device for quick detection and the typification of the virus of foot and mouth. This project was demanded by the government of Brazil in 2022. I cannot remember exactly the year. And we had the first challenge to buy the commercial kits to perform this project. We searched in the internet all the people that were offering at the time, and we asked to the media who had available, and we didn't receive a lot of answers, but one business answer, but still we still had a lot of difficulties to buy, and all the bureaucracy in order to buy the kits. So that was a challenge. So this was a work. I understand very well why the countries are asking this type of technical cooperation. It's evident. We understand the advance of all American continent free of foot and mouth disease, and the threats are surfacing due to foot and mouth, as you can see in several continents, including the reintroduction with countries free from time to time. Surveillance of the epidemic must be reinforced. We have talked about a lot during the morning sessions. What we are talking here, to have available more methods, validators, knowing which one is the validation, being with epithelials, using a collection of samples for foot and mouth. This is a brief introduction. As you can see, that when there is a notification that has been already placed, it is responsibility, not obligation of the citizen, of the producers, especially the private veterinarians. And of course, that maximum time, we know that that time needs to be given in 24 hours, some countries 12 hours. And in this instance, the veterinarian can see that there are several problems. Depending on the time of the beginning of the clinical signals, because they don't know of is this a vesicular stimular or a foot and mouth. So immediately, the first disease that must be diagnosed, it has to be foot and mouth in order to discard and being able to realize if we are facing an emergency or not. So these quick tests are very, very important, because the veterinarian is going to have another tool in order to have a better understanding of which case is he facing. We are talking about quick tests and not antibodies. In the human area, those tests are used a lot, especially during the time of the COVID. We all know very well all that scenario. Some others for virus detection or antibodies detection. In the case of foot and mouth is for the detection of the virus. And for the detection of the virus is epithelial disease, especially the vesicular fluids or the epithelial tissue. And it's good to remark this, that most of the countries is made with special attention by the official services. In this case, was taken by the decision and of some country taking those quick tests, and it's exclusive of the official service. I forgot to mention this. I forgot to put this slide. The sample that is taken from the epithelial, as you can see in the picture, is normally sent to the laboratory. Some countries have some other laboratories where it's handled with a biosafety environment. Well, ideally, when this test is not sent to a very safe laboratories, that sample must be inoculated in order that we don't have the risk of a virus release, accidental release. in case that we have a foot and mouth. So we have to be very, very careful with biosafety. In the laboratory, currently, most of the countries execute that rapid test conventionally, isolated, orological methods, molecular. With all of these methods, it takes a little bit more of time. And the trajectory, if that sample was not inactivated. In some places they have biosafety. Those are very expensive places, and they need specialized equipment and personnel. But the quick detection test, they give us a quick answer in order to avoid all this delay. But they definitely and obviously they do not substitute the test. So that laboratory tests must be performed, but an official colleague in the field will have another tool in order to take decisions with more conviction. Let's put it that way. If he managed to get a quick test, what is the stability and the specification of it? It was tested in the field test and not in the laboratory. Isolation, where there is a huge viral load facing that is that Brazil requested to try and test this commercial test in order to test in epithelial tissues. The main objective, the main goal here is quickness, to incorporate new tools in the diagnosis of for the mouse, and also the safe send and low cost of suspected samples. And I'm going to say why safety send, because with this tool is easier. We have already made with several agents to try to, but it's always more complicated than having a device to inactivate it. Based on this is that we work. The advantages. It can be performed at the point of origin, let's say in the bill. They are very accessible. We call that because the benefit cost is they are very easy to perform. In 10 minutes you have the result without the necessity of a lot of equipment. Quick detection of the virus, send of the samples in room temperature, and also we can inactivate the virus faster. It's a validated method that allows us to continue with the complementary exams and tests in the laboratory. How does it work? We are going to detect in the environment. We have a particle. I'm going to talk very fast so we can have a better idea. The antibody allows manage to recapture any type of foot and mouth disease, and then to include which are the types are of more risk, and the antibody of control. And so the material containing the virus will be included in the membrane. The virus flows in the membrane, and the sequence is nanoconjugated with the antibody, and that way we're going to have the marking. This is a very simple method, but in order to perform it is very, very easy. Which was the sample that we use? Always the difficulty to validate this type of test. It's very difficult to have a sample of the matrix in which we can try. So we're going to use 105 samples of lingual epithelium, empodal, bovine, truly positive for the virus of foot and mouth from the collection of Panaftosa. That is the preliminary results. We have a lot more of epitheliums to try. the or serotype A. This is a result that we made. As we can see, we had 52 FMD detected in the linear in the first picture, in the second A, and the virus non-detected. This was the result. This was the result that, from our point of view, is very good considering that it was a test with this purpose. From five samples, 93% the virus was detected. The serotype is the one that detects also. So this gave us a red sign that it might be foot-and-mouth disease. In the typification, we obtained 83% for O and 82 for that result. That result points for a good sensibility that I am calling 88%, and the sensibility is smaller because there were some samples that in the molecular biology was lower, and that was not detected because it's less sensitive than the molecular one. And so sending this dispositive, because it's easier to send, must be sent or detected. If it's detected or not detected, it still has to be sent, and in the laboratory, the detection will be made. Obviously, sending it is very simple. You just put it in an envelope. There is no necessary to use a triple emballagement because it's more expensive. Considering the difficulties that we had acquiring those commercial tests, Angela Hardin, she's a professional. She mentioned and embraced that in order to develop, and we are at the same time validating what is commercial. As a preliminary consideration, this is a preliminary project. After that, we are going to go more in deep with it. But the devices reveal is that it's a very useful device to detect the virus, and the purpose test is super sensible. We witness a very good performance, and the specificity, even though we use only 11 samples until now, which was epithelium, Pseudopoppis virus, Seneca virus, we have to perform more, and we have those samples, but it's because of the lack of time that we have the possibilities to adapt other countries' protocols for the use of that device. And so recalling that it doesn't eliminate the test that has to be confirmed in a laboratory, because the laboratory has to say if it's positive or negative. Thank you very much. Thanks, Doctora Maristel. Excellent presentation. Now, it's the chance for Dr. Gabriel Sanchez Torres, also from Panaftosa. He is going to give us a comparative vision about the sections of the official veterinarians with or without the vaccine. Thank you, doctor.
Good afternoon to everyone. Good afternoon. It's an honor for me to be here to talk about the study that we have developed during these years with cooperation with the Ministry of Culture and SENASAC institution that is focused on the monitoring the free zones of vaccines with sensors. The main objective of the study was evaluate the perception of the veterinarians, technicians, and how long they take to monitoring along the studies related to foot-mouth diseases and other diseases without and with vaccines. So which one was the perception of the time and the doses that they implemented? First of all, I want to thank you to everyone who has helped in this study. Some of them are here. Thank you very much, and also for the Cultural Ministry of Brazil, but also to help the project, Milton Morales y Ana Carolina Fayani, for the CERSAC, Dr. Pedraza, y also the services of the Dor Grande del Sur y the Dr. Graciela Yorgo. Here in Santa Cruz, thank you very much. Mariana, Graciali, y Walter Ibarechi también. Thank you also for the help. And Acre Genam, Adriana, please. I want to thank you for the cooperation and for the story. We didn't this alone, just us, but also with the cooperation of all the involved parties here. The methodology. We coordinate with the gestures and the participants how is going to the study going to be, but we find a way to send this form to the participants to evaluate the information. So if they can participate, they had to they needed and required some data. They need to work in local centers for at least 2 years with the vaccine and another 2 years without vaccine. In this participation, the transition was really interesting the last 5 years. Well, the digital form, as I made obligate to the Bolivian also a center and technicians and all the colleagues that participate in this study. Well, first of all, we used a pilot. Like, we tried to validate the form that we sent. We tried to evaluate the first form to the services of Brazil and Bolivia, if they could understand what was the questions about and if they understand it. The June and until August of 2024, and at the end of that year and in the first trimester in 2025, the data were evaluated for this team. We sent this form for a lot of veterinarians that had the requirements, but not all of them respond. But if there's someone here, especially in Senasac, that help us and reply to this form, I literally say thank you, because not everyone respond to this. They also had the requirements, but they didn't reply. 34 were the ones who had the requirements, but just 20 replied to the form. But in Brazil, 3,000 had the requirements, but just 165 just reply. It was less than 50%, but it was a lot of difference. For example, the Acre State, the percent of reply was really great, so I say thank you to them. And in other states weren't so favorable and great reply that we had. For example, 5% of reply was really low number of percent. Of Brazil, 165 were participant. Acre State, Gordon State were the states that were participating in the forum. In Bolivia, just some of the veterans were less than 30. The idea is not to get into details of the form, but I want to just show the replies and how was the form sent to the rest of the medical technicians. So we had this scenario with vaccine. So before the vaccine, how many years, how many days do you need to manage all the vaccination stage? And some of them say 11 to 30 days, but some of them say 30 to 165 days. That means that 41% was 11 days, the most current reply. So the majority says that 21 and 60% of the time was managed for the vaccination stage of preparation. So we ask how many days or how much of their time they need to prepare this stage of preparation for the vaccine. And the majority said more than 45 days. We thought, like, we didn't put in an interval or timeline for that. We thought that the lowest reply would be the February, but it wasn't. The February was 45, so more than 80% reply 45 days. So it's a lot of time for this stage of vaccine. So we get to the final stage after the vaccine. 30% of the reply were more than 30 days. This was a lot of time. Like, it's not that we just added all the stages and we add all the numbers. No, that was the number, the February reply for everyone. The majority said 35 to 41% of the time of their job was required to this stage of vaccine. It's a considerable amount of time. So that means like a year, a whole year, as the whole stages of vaccines. More than 54% of the vaccines. That represents more than 50% of their time in their jobs. That's the idea that we had at first without the study, but we thought that the veterinarians would be spending less than 50% of their job time. But 3 months maybe for each stage, and 2 stages it would be a half year, but I don't know, like it was in more empiric way, but the studies just confirmed the information. So at the end, we required to reply this question, like, how are we going to implement these stages into the vaccine? More than 50% says that they have more free time to implement these stages of the vaccine, but the less important reply was less time. So we can see that there is a standard. Like, we see like the answer were almost the same. The majority of the time of the job of the medical teams, they said that they spend more than 50% of their time. We have the only question where when we asked it about the fiscalization of the transition to each stage, and the favorite answer was the second one. It says that when they end the vaccine stage, they spend some time fiscalization with the fiscalization and the regulation of each policy. Although 45% of the veterinarians says that they have more time than the other ones, and the majority said that they have more time to implement the next stages of the vaccine according to the form. So according to the another programs we want to implement, the favorite option that had 60% of replies says that they have more time to spend in another programs. So this is not quite different from the things and the replies that we thought. So when the veterinarian says that in general they have more time than to do another activities, that's what we thought at first. So it's not different than we thought. So some conclusions that we had is the majority said that they spent at least 7 days. That's what we thought at first, like 90 days for each stage of vaccine, maybe 30 for each stage. In the 3 stage are 90, so that's the same reply that we thought. And 50% of the time that they spent, yes, they spent it into the stage of vaccine. So this stage of vaccine left more time to spend in another activities. So the veterinarian said that they have less time to another activities, but that was not the majority. So we wanted to make another studies who replied to this form, especially for Senosac, to understand how was the answer related to each one. And they say that some way they had less time or the same time because they did that reply not because of the vaccine stage, but another situations external from the program because they currently not working about the vaccine stages. They are trying to develop another type of programs in agricultural programs, safety food, and another activity. So that's not the reason why they have less time to spend. So yeah, we had this type of cases. We didn't have too much time to analyze, but this wasn't related to the vaccine of foot mouth diseases. So the implementation of the different stages of the vaccine requires less time than we thought. So I want to be focused and remain this type of replies. So I know we here have different specialists. For example, Alicia has a PhD about this type of implementation of vaccines. So this type of data, we must be evaluated and have the quality of information that we need. But this information that we had generated, we understand which route we must to follow and lead. So we know that when we stop spending time to implement the vaccine, we know what we must do. So yeah, that was all. I spent less time than I thought. Thank you very much. Excellent. Very interesting, Dr. Gabriel. We thank you for the presentation. Finally, we present to Bruno Javier, Ingeniero from SENAX from Paraguay, who is going to expose the costs and benefits to implement a strategy to consolidate the different factors of the vaccine. It's really important for take decisions and make some strategies. Go ahead, doctor.
Where are all the Paraguayan people? Good afternoon, everyone. Thanks, Paneposa, for inviting me for this event. Basically, I would like to share with you a study that we performed last year in Paraguay about the evaluation of benefit cost related to foot-and-mouth disease. This study, we did it with a joint effort with the University of Zamorano in CAE, the business school, the government of Paraguay represented by SENAXA, and financed by the bid. Okay, I'm going. I wanted to share with you more content. This is the topics I would like to share with you are about cattle ranch in Paraguay, opinion and positions, reference to vaccination, foot and mouth disease vaccination and effects in the market, the meat cattle farming in Paraguay. We perform an analysis since 2017 until 2022 using as the source the data established in FAUSTAT, in which we can see that during that period of time, the meat exportations in relation with the total exportations of all the countries that you can see in that report. They report that Paraguay, at least for Paraguay, it represents at least a 12.6% for the year 2022 of all the exportations that Paraguay does. That also was complemented by an analysis related to the exportation of meat in relation to the total production, in which since 2017 to 2022, we were able to obtain a media that all of the meat production in Paraguay during that period of time, 78.9% approximately, was destined for foreign market. This year, we have also performed and finished some studies related to the percentage, let's say, of the virtuosity circle related to meat in relation to the PIB in Paraguay. And all the chain of production in the meat of Paraguay represents at least 12% of the internal product. When I say meat, not only I refer to the producer, also the industry, the economics, all the logistics, and also the service sector, and also represents 16% of the economic active population in Paraguay. So we can conclude that for Paraguay, meat cattle ranching not only represents another product, is just one of the main products when it comes to exportations. And for that reason, we, as the government of Paraguay, the change of status is more than just an improvement, but it is a public policy that implies that all the acting parts are concentrated the way in order to do that, to take that step. In relation to the work that we did, we made some test surveys in order to know their position in relation to the topic of the retrieving the vaccination against the total universe of the survey. 47% was against lifting the vaccines. However, 43% of the producers were in favor as long as certain conditions are met. How it will be, for example, some guarantees that I'm going to show you during my presentation. The conditions that some of the producers require were concentrated basically in three big groups. And one side, guarantees, safe orders, and monitoring control. Further ahead, I am also going to express share with you what the activities, the concrete activities that the service were doing. So we can show you all these questions that the producer has. When it comes to the vaccination and market effects of the foot-and-mouth disease, we perform analysis about 234 observations in 39 different countries and different regions and their evolution along that 6-year time lapse. And we group them in those 5 categories, in which first category is countries free without vaccination, the area of NAFTA, the European Union. Category 2 will be countries free of foot-and-mouth without vaccination, which we in the area of Central America and South America. Category 3, it will be the countries free of foot-and-mouth with vaccines, and category 4 will be free with vaccine, but during the time period of analysis, some outbreaks had been reported, and category 5 will be basically the countries in which there is no information of the status altogether. In the study that we performed, we did it through a model of access and improvement of prices, which explains the price of sale, average price of sale, and another combined category. Basically, this study, what we could gather and conclude that we didn't have enough evidence that the change of status may have a linear relation with an improvement in the prices in the exportations. However, we also estimated that change of status might bring additional benefits that I will share with you later on. When it comes to financial effects in the schemes of vaccination, we perform a model. We realized the uncertainty of the in the years where we had outbreaks, and also the uncertainty in the prices model through probability function modeling. Basically, what we did was all the scenarios. We have an actual scenario that basically is free of foot-and-mouth with vaccination, in which the country at the moment is investing in a projection of 10 years, which is $133 million in order to keep the status free of foot-and-mouth without vaccination. However, we made a scenario in which the country can change free of foot-and-mouth without vaccination. In that scenario, we went to an extreme in which we stop vaccinated without the necessity of investing more. Additionally, what we are doing in analysis and risk. And the study brought forward some positive $1,700 million, again in a time of lapse of 10 years. When those scenarios are brought forward to a scenario with an outbreak, we made a modeling that contemplated 100,000 possible cases. We saw that in the scenario with foot-and-mouth with vaccination, 90% of the scenarios that we modeled generate a loss in case there is an outbreak of $882 million for the whole country. This is a scenario of foot-and-mouth with vaccination. Once again, we made a model in which the scenario of foot-and-mouth without vaccination, we model again in a time lapse of 10 years, 100,000 scenarios, and in that time lapse, established that 67% of the scenarios, there is a probability that even though we have an outbreak, there might be some positive result of $200 million. What is the reason for these scenarios? We contemplate that in a status free of foot-and-mouth without vaccination, basically, we may have access to quicker access to the markets. I give you an example. When we were doing the analysis, we received a request from a country in Africa in which the first thing that we're asking from us, it was related to if we were free of foot and mouth without vaccination. And if the answer was no, we will have to send an amount of dossiers in order to begin the transactions. The other thing that we could gain in the scenario of free without vaccination is related to the improvement of the access of net products. What do I mean with this? That we could reach more countries in the exportations of meat and bone. At the moment, Paraguay is exporting meat and bone to Israel. However, we believe with that change of status, the negotiations could be more dynamic. In the same side, we will also have a reduction when it comes to decrease of by-accesses. And obviously, what it will be definitely increased considerably, it will be the access, or better put, the exportation of products, of swine products. At the moment, Paraguay, making a comparison in the last 4 years, the swine area has grown 50% with the actual status. So let's imagine where could we go in a scenario of changing the status. I would like to talk about competitivity. We also perform an analysis of the last 2017-2022 of some of the countries in the region when it comes to competitiveness, and what we took into account the price of the kilogram imported against the productivity per kilo. And basically we have a slide of what it was in 2017, and this is the picture of 2022. As you can see, most of the countries have improved when it comes to productivity and also in the price. However, Paraguay we're a little bit behind. So our question was, if we have basically the same status, what activities we are doing differently that is not the status that probably are contributing to have a better competitivity. Among those, we analyze Brazil, Colombia, Argentina, Paraguay. As 2022, I need to make emphasis. We had the same status, and we see on one side that the governments have worked a lot related to the meat industry, and on the other hand, the promotion of meat production, in which Argentina and Uruguay have moved forward in activities related to that sector, and everything related to the traceability that Uruguay has developed this from a long, long time ago. And so in Paraguay, what have we been doing in order to improve the competitiveness and monitoreo from the SENACSA? First thing, we were one of the very first countries and to be added to the Bambaco in 2021. And after that, we started to analyze several investments in technology. In SENACSA, right now, we have a software for laboratory administration. In real time, we can perform the monitoring of the samples that are coming in, and we also have a system, informatic system of animal, which is very strong. It's 2.0. We have also performed designs, and we have started to implement the application of Membata P, which allows us to monitor the charge of cattle from one establishment to the avatar, and this format is going to have some referencing, and in real time we have also invested in a program that for us is a public policy, is the identification of the animals in Paraguay. That it took us 3 years of cooperative work between the sectors in which we came along and agreed in the topics relevant for the country. It became a law. It was taken to the Congress of the Nation. In 2023, the President of the Republic, Santiago Peña, promotes the law, and since that year, we started in the phase of implementing that, in which, in real time, it doesn't matter what country you are, you can enter and access and identify and see all the data. We have registered more than 1 million, and this keeps adding and adding. We have also invested in Potencin, the cyber. It's one of the systems very, very relevant in Senaxa, and it's a window that allows us that the same producer that has more than 500 heads of cattle can perform and manage his farm. In order to conclude with everything I have shared with you, we conclude that meat farming in Paraguay is the most important, that it could be the neighboring countries, which due to 78% goes for exportations. In general, there is a resilience to abandon the program of vaccination from the producers themselves. We also may conclude that the cattle breeders in Paraguay in general are very satisfied with the technical job that Senaxa is performing. We couldn't find differences or evidence when it comes to difference of prices between the status of Simba without vaccination or with vaccination, considering just the one variable, which is the change of status. In a scenario free, without the occurrence of an outbreak, there is a potential to obtain beneficial for Paraguay's. And to finish, we have conditions to highlight in the region. However, we need to continue improving in the competitivity and developing and implementing plans of productive Peter Pan. That will be everything. Thank you very much, all of you. Thanks. Excellent. I would like to thank Dr. Bruno for his presentation. We'll ask him to stay in the platform. We're going to continue with that debate, which is not going to be 40 minutes, it's going to be 20, 25 minutes. So I invite all the participants or the panelists to be here. And please access the Lido platform so you can ask your questions if you have.
Well, here we are for the second part of the session that is really interesting because it's out of the presentation and the slides. So we're going to start with the questions, more direct for yourself. So I'll separate 2 or 3 questions, at least for each one, as we said at first. I still have some of the questions that they made before to clarify some of the doubts that we had. I want to start with Ecuador. She manifested the first presentation related to to the subject. This question is really interesting. What's the perception of risk of Ecuador from the cattlemate? How is your cattlemate seeing the situation of the situation that you are trying to implement the risk? Well, the risk and the implementation risk, we have to coordinate to the private sector and to the fiscalization control institution to make the best decision to the transition of status. But you are still trying to trust these institutions. Yeah, you are trusting this ground of the institution. So yeah. Marisa Pestuco, what's the possibility that Panafitosa develops this new test that you have shown us for the Americas region? Well, as I said from the beginning, the objective was reminding we were worrying about all this region. We want the region be more consciousness about the subject. So the possibility to implement this new test of form, of course, we can develop. If there's a demand of this project, we're going to try to initiate the discussion. One question to Paraguay, Bruno. The survey that has demonstrated that there's a lot of percent of each one. It has a percentual value, like there was a mixture of the different producers and landscape producers. Yeah, of course. Thank you for the question. Well, basically, we have made a survey to the different type of straight of veterinarians, 1,120 persons. So this survey showed that the standard man was open for 2 weeks, and we received different response from the gentleman. The person who had made the question, well, I can of course bring some information and all the details about the survey that we made. Because of the word, I didn't try to get into details about the form and the survey, but yeah, there was a lot of different type of sentiment. And when they want to implement the vaccine or not, well, there's more than 500 or 1,000. There wasn't ready for the implementation for the vaccine. But yeah, there's a few number of people that were agreed with the idea. And how many replies did you have? Well, we approximately had 800 replies of the survey in 2 weeks. So that was the presentation of the slide, right? Yeah. So we continue with the next question. That it seems really interesting. Okay, Gabriela. There's a question. Gabriel, to Gabriel. Can talk about this. Where is it? One moment. During the vaccine, the monitoring is major because of the quantity of animals, or what details do you have for this? Well, that's a good question. I have seen present 2 slides saying all this information, but when we had the first contact with the veterinarian or the producer, yeah, it could be, but there's a really big important detail. We must to think about this detail. Okay, I will get to this detail later. But when we have and got the vaccine, of course they have more free time to spend. So that's where the veteran has to implement the other programs maybe, or implement the monitoring about the implementation that they have. They must to be in field and know the reality of the implementation, and the thing they must know the farm, the land. They must be in field. So if you go to the countryside to vaccine, well, the maximum effort is to vaccine, and there doesn't know if they how's the context of the area or so on. So you have to spend the same time to see the risk and the implementation risk and how is the context, so you can prevent the sensibility of the risk. If you have more time, you're not going to a farm to just make the vaccine. You're going to know the field, to the zone, the context, and how is the point of risk, and which system do you need to implement according to the context. So all the factors are important. Do you know which ones are? You know that some farms have a lot of migration. Some of them are near to airports. You know, like the time that you have to implement the vaccine, you're going to use to implement the whole procedure, using the context and analyzing the context. I know that any country would escape from this step, because we must know the risk. That's the main detail, so we can direction the new strategies to prevent this type of risk. And this is the best and most efficient way to vaccine. I would like to make a comment about this for you all also. The veteran services that the country has is not exclusively just for foot-mouth disease. That's extremely relevant. Of course, we are here more than 50 years talking about this, but there's more subjects to deal with, more struggle and challenges in a professional level, the structure, and even if we find a way to try to make the best procedure to vaccine in certain areas or zones, of course we must to see another suspect or type of risk to analyze, especially the content. But there's a lot of challenges that each zone and area need to improve, not just around this disease. So we can improve the quality of the services. Thank you, doctor, for the service and the information. Of course, for the government of Paraguay, here I have this comment and question related to localization of Paraguay. Paraguay is a country who's located between Brazil and Argentina. So what do you think it could be the risk of new outbreak of the disease? Like, what's the possibility of an outbreak? Or something that's worrying the country about the recognition of the free vaccine zone in this type of zone. So this is really interesting. Okay, let me get if I did understand. In 2021, we realized this risk analysis of external factors that could maybe affect it about foot-mouth diseases and aviar and another exotic diseases. But immediately on, gives us this result representing that the probability of the outbreak occurring in Paraguay for external factors, it could be 0.000%. So I don't want to take a risk about where could be the external factor bring a new outbreak. Wait, there's another factor. There's a lot of external factors. Yeah, we analyze the external factor here, but it's mostly and zero possibility of this external factor. Okay, but we're talking about 4 countries that could have an outbreak of this external factor, for example, that have made the certificate of free vaccine. So, and the rest of the zones, maybe they don't have this certificate. So this is a different scenario since 25 years ago. As you know, as the pandemic exploded in the South American countries. Of course, I know, and I'm really interested to see if COSALFA can maybe find the external factor where the outbreak initiated and began. And that's all. Okay, following to Paraguay, I will like to say this. There's a point I made. I'm lost. Wait. To move forward. Here there is. Have you considered the analysis? Have you considered the analysis that you are making, the cost, the direct cost of the vaccine, and the management and the use and management of the resources, financial resources, indirect and direct, about the animal livestock, the finance, the wine, the meat, the food, and all the management that belongs to all the procedure that you have explained, but also the timeline of the livestock and producers that managed during the vaccine management. Yeah, of course, the factor that was the most hard way to find was not just the cost, but well, in economy we have this concept, opportunity and cost, that implies related how you can receive something when you do something. So that was a really big challenge. Of course, we did that. In the slide that we have, and I present, we have this type of investment. I call it investment because at the end, you realize this type of status. We're going to call it cost also, but you invest because you're doing something in a way like 8%, that's 3.7 millions of dollars, 13 millions of dollars per year. It's how it costs, well, what we invest to stay and maintain this status. So that's how much we try to apply. And this cost and opportunity number brings you what? Yeah, of course it brings, with this university, we try to make this test, and yes, it's a percent, 5%. Well, to Ecuador, how have you analyzed the state of Venezuela, and what are the risks that they have? Well, I think that the relevant point about this question is the information must be clear and published into the WAHIS platform. It's really hard to determine the country situation, but to upload all the information so we can analyze and be specific, of course we must to upload all the information. Yeah, but you are not the borderline of this country, so, right? Yeah, I'm not. But this part of the study says that you act like a borderline and evaluating all the risk from that. Yeah, we're comparing with all the countries along the South America, not just the borderline. Okay, thank you. Next, Ecuador. There's a question. When when are you going to end the analysis, the risk analysis? Because you have made this study per hour, and what's the program that Ecuador has prevented for the vaccine implementation? Well, Ecuador, yes, we determinate this evaluation with a report, a technical report. It's already in the testing and preparation and the conclusion stage, so to the publishment. Okay, thank you very much. Maristela, okay, for ending. There's a kit that you have proved that it's validated, and it's also a version of, well, there's another country. What type of tests would you make to complement the last preventive device?
Ele foi validado
The last device that we implement, it was validated for the university and also for the institution, but it was also the supplements and the supplies that was validated. So the supplies and the material that we have was also validated. So that was a reference collision with a fusion of the information with the system that we was implementing and creating. It's impossible to make the device all over again, but we can develop and improve what we have made. Of course, if we demonstrate that there's different analysis of the studies that we have made, we can improve the type of analysis we're making. And in a consequence of the studies that we have made, also the demands are really important. Brazil also, of course, can share the studies and the supplies as they can show and validate for another and complete way. Okay, thank you. I think there's a big and important examples of Paraguay, the point of view of Ecuador, Maristela. So this provoked to another countries of different initiatives, so you can improve and go forward for a new knowledge for the strategies and maintenance for the health and sanitary and new strategies, so we can improve the enforcement, and we can agree with the same effort to find to improve the veterinarian systems and all the tools and devices. So I say thank you to Bruno from Paraguay, to Maristela from Brazil, to Paraguay, but also Gabriel, for the opportunity for us to make a discussion today. So thank you for the participation. We move forward. Thank you to everyone, to the participants here. We're going to have this very determined time, so we can come back in 20 minutes. Thank you, everyone.
Recta final ya.
Al fin.
Understand it's very nice to take a break, but this is our last session. It's going to be very interesting, so I ask all of you to take your places so we can commence the last session of the day. Please, we're going to proceed to close the door so the people that are outside can return to their room and occupy their seats. We'll ask once again all the attendees to take their places so we can commence. During all this time and during the breaks, you have been able to contemplate all the work in the totems located to the right side of the room. And precisely from all the people that have participated, saying in their jobs, their work, we have the moment now to choose the best 3 imposters selected. And the presentations is going to be in charge of our coordinator of the laboratory, Euclides de la Torre. I ask a round of applause for him, please. Good afternoon, everyone. I don't know if for the microphone is good for my height. I think this is, yeah, we are all tired, but I think it's very motivating to see the interest and compromise of all of you to being here present in these 4 sessions about the presentation of the 3 best works that were selected by the technical committee of the organization. The first thing I want to do is to thank all the participants that sent their works, their articles, and they were represented in the left side of the room, the right of mine, during all the day. Is very important to observe and being able to know all these works. I think this is a very good chance for all the participants and also for the countries and institutions to being able to share all that technical knowledge, scientific knowledge that is being done in the field and allows us to know all the reality in different regions in our countries. The works that we're going to present, that are going to be presented now, is a clear example of what is innovation, the commitment and technical work, and how can they contribute to the prevention programs and surveillance for the disease, not only for foot and mouth, but also other diseases that we are going to be able to see during the presentations. These works were selected out of different contributions due to their quality, pertinence, and potential impact that reflects novelty, focus, and valuable experience that deserve to be broadcasted. I'm sure, and we are sure, that these presentations will enrich our understanding about the diversity of the tools and the strategies that are being applied in the region, and this is allowing us to strengthen the health of the animal systems. After this introduction, I would like to invite Madori Machado from the University of Santa Maria, Brazil. She's going to show us the developed intelligent system. This tool may be able to optimize technical answer in emergency situations in foot and mouth disease and other trans-border disease. I ask a round of applause for our panelists. First, good evening. My name is Felipe. I am a student the computing system in Santa Maria. this is a work that is fruit of a cooperation of the Santa Maria University, along with the Secretary of State of Rio Grande do Sul. And this came firstly due to the impact of sanitary events. We know that diseases like foot and mouth, avian influenza, they have great impact, and the consequences affect the public health and economic damage, whether because market is closed. We had recent examples and events. We have some influenza in 2024. We have an outbreak of foot and mouth in Germany in 2025 and avian flu in the US. And with these recent examples, we managed to identify the challenges and the complexity in order to do the management of the focus. Is very, very big. So we had implementation of control measurements, investigations of possible new outbreaks, and this generates a necessity very big in an efficient planning, coordinate the data and the equipment, ideally in real time, and in modernization, and a register of this activity in order to facilitate the analysis of all the data gathered. This all with a systematized support in order to take decisions, facilitates. And so then if we need some support in order to make decisions in the area of computing, these are topics based on knowledge, which definition in 97 specifies a group of concepts in a shared way. Because it's a language, it's explicit because it leaves very clear which are the entities and of a specific knowledge, and it's shared because at the time that is in the vocabulary can be shared in more than one system and allows to model the rules that are going to allow us to generate new knowledges, and the systems based in knowledge. And those they provide support in the decision making. They allow us to capture and process data in real time. It makes our job easier, facilitates our analysis. With the understanding of this computational concept, we bring out the projections that are going to be using this ontology. And with this, we are going to do the model of entities that are present in a sanitary event. So we can manage to have a system that will help us in the decision making. So after talking with specialists in the area, we came to all these entities in a simple way, in which we are going to have the data collection, risk areas, farms, and all the people involved and their relationships between them. In this way, we have a representation, visual representation of what is a sanitary event, and with this representation, we can see that it's very complex. And with that, our system, with base in that ontology and in that model, we divide in functionalities, analysis general, in which we can visualize georeferentially of the productive unity, or they use in the case of Brazil with Castro Rural and Environmental, which provides the delimitation of the area of the property. And pro-focus analysis, we can identify all the focal points, limit the areas between surveillance and protection, and also to have access to the history of some specific outbreaks. Once we do this analysis, then we are able to start to provide an answer to this possible outbreak, in which we can define teams, ask people from human resources for that answer, create formularies that are going to be used for all the data collection in the forms. And once we have all this management done, we can have we have the pageboarding, which shows us how many farms have been inspected by team, by region, and also data recollection can be done offline. And after we have internet connection, they are going to be synchronized. And so these two tools was prototyped and tested in a laboratory. And after that, we had two real scenarios in which we had the chance to use one of them. It was the search of an outbreak in Rio Pardo in February of 2024. And the other one was in Newcastle, also in the year 2024. Using this system, we managed to acquire and do the analysis of the data collected by. Adding to that, we improve the management of the equipment in the field and facilitation to contain the outbreak. I'm going to show you some slides that do not represent a real outbreak. They were done in a laboratory in order to demonstrate how to use the system. First, we have an outbreak responsible to respond to this event, and he can do an analysis. So he's going to add the outbreak point, limit the area, 3, 10, or 25 kilometers, and he can also cancel the mobilization of that outbreak of the point. With that, he can have a very good notion of what areas producers are in that region. How many are in that radius of 10 kilometers? And for whom that focus receive and send animals. This helps us understand which is going to be the dimension and the size of that event in that job. In a second instance, this focus can create some clusters, and within these clusters, we're going to locate teams. These teams are made by official veterinarians. With that, by having these associations of teams in the area of acting, it's available for those veterinarians an application in the cell phone. All these properties that needs to be collected by his team in this case, in which they show how many needs to be, the map of the region in which he has to do the work, and a formulary that was created by the same gesture, a formulary with questions and answers for that event. With that, after the veterinarian doctors go to the field and collecting all the information on base board of the total collect of the event, and by team, he can understand which team is having a faster collection, or if that area of that team needs to have more people, or if you have another type of feedback depending on the region, and a visual map in which you can see where it was collected in order to help with that visual collection, and where maybe we need to reinforce our workforce. After using the system, we perform an evaluation of the same, in which the goal was to see the ability, efficiency, and utility, and the management of these events. And our method was use system within SCAN that is a formulary, it's 10 questions in which we have 29 professionals answering these questionnaires. These doctors participated in the Newcastle outbreak. With that, we managed to 75.5%. That indicates us that the system have room for improvement. In which, for example, those are the 10 questions. I'm not going to go through all of them, but in the moment of evaluation, the questions, the bigger the note, the better, and the impairs, the lower, the better. I would like to use this system with more frequency. An average of 4.7 is confirming this affirmative, and the system is not exactly complex. Some people did not agree with that. And to conclude, the benefits of the CEHIP, so we managed to acquire an improvement in the analysis of data, a more efficient answer. The time of recollection of the data is lower, and also we were able to use human and material resources in a less amount. So it's very important, the use of technological tools, because these are essential tools. Looking at all the results gathered, and that allows us to measure the data. Better data so we can work in the future. For example, we can use this for other diseases, but a sanitary event may be from one disease. And since this is not specified, we can adapt this base of data in order to accept more rules from different entities, so we can be more specific. Some disease. And so since the base is an event, it can be performed in other ones, so we can apply this to other and different countries. Thanks. I would like to thank the staff of the Secretary of the State of Cerro Grande do Sur for all of their support and trust in our work, and I would like to also thank Fundes for supporting this work.
We say thank you to Felipe for the presentation. That will share all the studies with the borderline of Venezuela. This meeting needs a special study in the new context to the safety system improvement. Well, first of all, I want to start telling why we realized this study. This study responds to basically the monitoring that we realize in Colombia, and to the necessity, the need to maintain the borderline with Venezuela in monitoring with the public sector as the private sector present that are present here in this activity. So we have found the importance and the need for the monitoring borderline with Venezuela in this work. So this study we have cooperate as a response to the vaccines that we realize in the zone, to the vaccines that we realize in the zone. So I want to talk about the place of the borderline. Well, this place, since 2024, we have made 3 cycles of vaccination. 2 of them were normal, and we implement the vaccine in the bovine livestock. We implement this vaccine, but the last cycle was implemented to the animals younger than the last group of study. So we can see the quality of the response of the study. So this study estimate the type of protection to the different groups. A24 protection, and the second one with different entities, different type of animals, the size, the fields, the number of the doses that we implement into these fields. For this guild and land, wait. Okay, about the methodology, I have to tell you, we realize different type of group that involved 30 types of, wait. Okay. 30,999 in 30 groups of bovine type livestock. That means 30 times and 76 municipalities. All the municipalities that are involved in the Venezuela's borderline. So this information must be clear. It involves all the zone in the borderline. That's where the location was studied, and in these groups we can see all the zone was involved in the study. So we can see we take the different supplies and in different groups of big, medium, and short terms of companies in veterinarian services. So for that, we try to take a knowledge the SFNL services that is provided for Senectos. Some of the information that we start finding, first of all, you can see in the right of the chart, well, the left for you, the location of the distribution about the supplies that we take. In each of the departments, we try to make an aleatory supply. We took a different number according to the context and the proportion of the animals in each field of the municipalities and departments. So that's why the supply, not all the departments hasn't the same amount of animals, and because of the field, different quantity of supplies and amount of animals. That's what happened when, for example, the age of the animals and the number of doses that we are implementing to each field. So the results were really satisfactory. Response to this study because more than 80% were protected in the fields that we analyzed, but 86.4% were completed with the system of implementation of the vaccine. But the different percentage was also the potential of the vaccine that we use. So that was the procedure to develop the different stages of vaccine implementation. I want to clarify two types of analysis, one for age and second of the number of doses. The study, as I said, was also analyzed by department and so on. So according to that, we can see different type of information, really interesting data. For example, for the age, the animals, when they are getting older, the protection of the vaccine increase. That's because it receives more doses as long as they get older. But if you see the different levels of the cases, they have levels, really high levels, and the maximum level when you get a level where they establish the new doses, for example, 13 and 18 point, there's not such a difference between the animals who had the vaccine or with the animals with 19 to 24 months old. So if we had if we took animals older than 24 months older, maybe the difference will be more significant. But for example, for the type 0, 1, and 24, of course there's a difference. The 0, 1 type shows an improvement of the doses and the implementation of the vaccine, but in Colombia we apply involved into the studies, the levels were higher according to the studies than the A24, but they are still higher levels. When we look according to the number of doses, this because okay, we how many doses are we going to give to an animal, and how many doses we involve into these animals, we must to analyze how many doses they can require. So we now have the studies and information of the supplies about the doses. So an animal younger than 24 months old, they receive even 5 doses in just 2 years alone. So this is a result of 2 cycles of the implementation of the vaccine and an additional cycle that we implement. So as long as they get older, the number of doses also gets higher, so the protection gets higher. But there's an instability in this comparison of the vaccine, because after the third doses, the levels maintain the stability. There's not such a difference between the other cycles, but we must to look if the main factor that's worrying is when the animal just received 1 doses, because the levels are acceptable, but for example 0.82% of the potential of the doses is like 90% of the vaccine. Of course it's acceptable for an animal, but after the third dose is unstable, even if it has more doses. Still the immunity stays 90% for the animals younger than 24 months old, but in the field that change. So basically we have these 5 conclusions in these studies. First of all, the work and the study that we proposed has this purpose, not just to Colombia but also to Venezuela borderline. We must see if these levels of protection are being given just because of the risk of the field or the
type of the animal maybe in the Venezuelan side, but the other result is the other answer is that if our zone of the borderline has a high level of immunity because of the doses and because of the studies that we made for the country. Well, we will see later where we are finding different type of immunity in human immunity. So if we have a high immunity in the population of the country, we have made some decisions in our program, a national program, like this next step to the south of the country to declare, like announce that the vaccine must be prepared. So we want to be certified until 2026, but also the two departments that are the borderline with Ecuador also shows the next cycles for the vaccine that we are going to implement and we are going to start. And the third conclusion is about the percent of protection that we bring to the animals are consistent with the allowance of the whole borderland zone, and the percent are being free of the supplies of the other laboratories that Colombia is supplying. The fourth conclusion is about the results are reflecting related to the impact of and the efficiency of the vaccine that we're using and the effect positively and the work as a team as we made as a private sector but also public sector, and especially for the supervision and monitoring of the different technicians and teams of veterinarians in the private sector, of the livestock marketers, producers that are also part of this study, and also the immunity and the doses is improving the immunity because of the oldest animals, and they have better respond to the supply of the vaccine after 18 months old, after 3 doses applied. And finally, I want to say thank you to all the colleagues of ICA, to the team of ICA, to Fedegan, for the producers, for the veterinarians. Hey, I'm here trying to show all this, but you must know that there's a lot of people behind all this study, between functionaries of ICA, veterinarians, technicians, in laboratories. There's a work that wasn't easy for us. There's a lot of collaboration between the teams, and it requires a real commitment related to all the producers about the vaccine. This is a really important step I want to remark, because the public and private sector was involved in all this. The second one, I want to give a special recognition to the ICA's personnel and the directive team, especially to all the epidemiological team, not because they are making the study and the monitoring part, but also the investigation and the studies about the modeling and the monitoring and control that they have been applied. Thank you very much. We say thank you to Dr. Adalberto for the presentation. This conclusion was really important and representing Colombia. Is going to improve our status about the investigation. So to end this presentation and this session, I want to invite to Ana Carolina Shane, the Director of the Center of Investigation of Mato Grosso that is going to present the results of the investigation about monitoring based on the risk. It was applied in different centers in Mato Grosso during the terms of 2023 and 2024. Thank you. Please go ahead.
Good afternoon, everyone. It's a pleasure being here. I would like to thank the host country, Bolivia, and Pan American Center of Food and Mouth for the realization of this event based on risk. Our work consists this strategy, the unified strategy of surveillance based in risk in rural establishments that was executed in the state of Mato Grosso between 2023 and 2024. This work was developed by 1,000 veterinary medical students and was supported by the technical support of the University of Sao Paulo and the Professor Fernando Ferreira. Introduction, the surveillance based in risk consists in search the disease in the population that possess more risk of being infected. In this way, our actions are more specific and effective in detecting the disease in case they are occurring in the territory. Our surveillance strategy prioritizes the diseases that are absent in the state of Mato Grosso, of which they have a big impact in the production in our country, in which we have international certifications, avian flu, porcine plagues, and also with EB, in the sense of mitigate the risk and provide the animal protein. So the strategy is based in scientific criteria and data analysis, which allows us to optimize that surveillance. So the surveillance performed by veterinarian official medics that can be performed in rural establishments selected, and they have a risk of the disease. In this way, we optimize and we improve or the go outings to the main goal of the surveillance in our territory is to promote the passive surveillance through the adoption of practical methods and the presence of the veterinarian medic in the establishment. She incentivizes the rural producers, and they're responsible by the management in order for them to participate in the surveillance systems. We know that the veterinarian service don't have good capacity of early detection in the visit of the establishments. Who are the producers? They are the ones managing those that are every day in contact with their animals. Those are the ones that need to be capacitated in order to recognize the diseases. We perform the education, so they manage observe these animals and recognize the medical signals, and so they can be close to the veterinarian service in order to communicate any suspicion. With that, we manage to perform a personalized training in each establishment visited. Adding to that, our veterinary medics inspect the animals along with the producer, and that has the certified capacity of that population of animals are without the disease thanks to the surveillance. We also use these visits for data recollection so we can update our, which is very, very useful and used to planning all the actions of surveillance. The methodology, I am going to talk very quick But yes, if you have a question, if you need to ask me something, I'll be more than happy to. We build some models for different diseases based in surveillance systems in the state of Mato Grosso and the risk factors for each one of the diseases. And that is associated for simulated models, which allows us to have the sensibility in our system. Our surveillance is based in the manual of Faudi, surveillance based in risk, and also described in my thesis of doctorate published in the year 2022. The rural establishments are selected based in the sensibility in the scheme of surveillance, which is the sensibility. Is the capacity of the system of surveillance to find at least one infected unit in case the disease is present in the herd. In this way, we manage to know how much surveillance is necessary and how many rural establishments am I going to watch, and what is the sensibility that my system handles. And this tool allows us to do this through this. We select which are the establishments that are going to be visited. Every 6 months, we run all the data in the risk, and we selected these rural establishments. Those rural establishments are sent for all the states and the municipalities, so the veterinary doctors can visit it. So we do have goals months, every 6 months and every 12 months. Going along with these goals needs to be, so all the surveillance is stable during all the months, and it's not only in the specific moments in the year. Operational procedures that we perform, we train with our field servers so they execute their activities in the field in all the municipalities of the state. We also perform every 6 months evaluations, and we proceed with feedback for the producers. The feedback is extremely important because it's when with the server that collects the data understand how important is the data that he is collecting, and also the data collected he sees in the form and shape of maps and graphics, and that produce a significant upgrade in participating in the system of surveillance. This is something that feedback itself. The more feedbacks we have, the better the system, and that is we get at the end of the process. Here we have an example how the activity is performed. They go to the field, they go along with the producer, and they visit all the animals along together. In that moment, the servers, the veterinarians explain what the producer needs to observe, and at the same time, the relationship between the idea and the producers. Is in this moment that the veterinarian observes the risk factors and also performs sanitary education in order to mitigate the risk, so we can have better practices, which is biosafety. But with this complex for the producers, we are going to teach them the good practice in handling these diseases so they don't reach your establishment, and that starts to make sense for all of them. And so we have today, we don't have more paper. We collect all the data in a software online through the use of tablets. That data are sent for, that is the face of our tablet, that is the screen. Our colleagues collect that information in the specific formularies, and that data feeds our information, which is our system that collects all the data of the surveillance and also communicates our integrated system of defense that we have, or the herds and the animal population. Automatically, that data feeds an interactive panel. That panel visualizes all the servers throughout that it's possible to accompany all the quantitative goals of the surveillance. How many farms need to be visited, which ones were visited, and which ones. And so it's very important for the management of the activity and the control of the actions that are being performed. We also, in cooperation with the private institutions of the state of Mato Grosso, with the GT of communications, and we mount our own material for the use of the surveillance. Examples of these folders that you can access through, if you scan this QR. Later I'm going to leave that in the screen for all of you. So the results in the year 2023, we visited 9,818 rural establishments based in risk. This corresponds to an index of surveillance of 96% of planet in relation to this surveillance. With bovines, we visited 775 rural establishments, and we monitor bovines. In relationship to the establishments with the INO, we're 809, and with surveillance for establishments with birds, that is the most of it. And we inspected 1,415,030 birds. I zoom in the map so you can see better. This is the map with all the geospatial distribution of all the establishments visited in the 2023. You can see that Binkenans is distributed in all of the region of the state. The green areas are areas of forest in which we don't have any rural establishments. That's why there are no points of visit. The rural bovine establishments are with an X. The swine ones are with and the bird ones with a circle. So we can easily see that several situations, even in rural establishments that were mentioned for surveillance, they possess risk for more than one disease. In one single visit, the veterinarian can manage to perform several activities, and that improves the performance of the surveillance. In 2024, we're going to move to the next slide. We will continue with sensibility. In the topic of sensibility in the 2023, 1% of prevalence of outbreaks, and we performed 1,000 simulations, and the yearly sensibility was 0.49. For swine plagues, it was 0.49, and for avian flu, 0.39. In percentage, we can say that 99% of detection any of these diseases, in the case that they might be happening in 1% of the territory of Mato Grosso. In relation to the results, in 2024, we visited 10,140 rural establishments. 99.76% of what we planned, we accomplished. With bovines, we inspected 8,000. We inspected 713,501 bovines. With swines, it was 581 establishments. We inspected 384 rural establishments with the birds, 7,257, and we inspected 2,024,026 birds. In the same way, we see in the map that we managed to see the geolocation of all the rural establishments supervised and monitored in 2024. It's important to mention that we take the decision in the state of Mato Grosso that we're not going to repeat the rural establishments. So the rural establishments that were surveyed were not the same that were in 2024, because we understand for a broader surveillance we managed to reach a bigger number, so we can sensibilize all the producers with the goal of a free area, which is the early detection. And who is in touch with the animals? Those are the rural producers. In the sense of the system of sensibility of the model, we consider a prevalence of the sign of 1%, and we perform 1,000 simulation in the year of 2024. Foot and mouth 299, swine plague 0.98, avian influenza 0.99. In percentage, we can say we have, with exception of swine plague, it was 98%. More about 99%, the probability of detecting any of these diseases. In the case they are happening, there is a 1% of prevalence. There is a prevalence of the design that was used for calculate. So the focus of the surveillance based in risk allows us to manage and availability of the resources in a much more efficient fashion. Adding to that, improve our sensibility. We managed to improve what we were doing historically, but with a higher sensibility, and that guarantee the distribution, the spatial distribution in the whole state, and also the temporal distribution in the at the time that we were vaccinating, the surveillance that were the fiscalization of vaccines, they were concentrated during the months of campaigns, which were May and November. Now, with the suspension of the vaccine, this allows us to plan and work in a better way with our surveillance. So doing that, the whole thing was stayed on all the months, and we have a broader surveillance. This project influenced directly our capacity for certification, mainly in the state of Mato Grosso, that lives out of their agricultural production, and they need to access all the markets and improve their production. The sensibility, in this case, for swine plague, avian flu, and foot and mouth with characteristics of surveillance system, they show us a high probability of detecting these diseases in the case these are happening in the state of Mato Grosso. This is it. I wanted to show you our work. I left our Instagram. Is idea.met. Give us a like. There is plenty of information. Weekly, we update in our social networks. And it's my email and my personal email there. In case that you want to get in touch, in order to clarify any doubts. And here I leave to finish the folders that we produce along with the private initiative that are used for the sanitary education. And you can just aim the camera of your cell phone and the folders will show up. Thank you very much. Thanks very much. So you can please remain in the platform so we can start the debate. And I'm going to call Felipe to come forward to the platform, please.
Now we are ready. Okay, thank you for the presentations to everyone. It was really interesting to see the different topics that you have presented. And now we're going to see the questions that the public has made. Maybe you can make some comments about them. First of all, with Felipe, one of the questions says, is more frequent question in the system says, how the system did work in the laboratory when you made the essays, when you tried to acknowledge all the information into the study. First of all, I want to say that it is a prototype in laboratory that was before the real cases, and we check all the cases, if we could compare and try to understand the real needs that everyone needs. All of us, all the teams, went to the field where the real cases happened, and there was always a person of our team trying to understand what the needs were, to attempt them and see the new functions or new demands that came around into the service, and we related to an emergency. So if one day maybe someone talk about an emergency, well, that will help to us to prevent as soon as possible the emergency, as faster as we can. That would be just it. There was a lot of issues that were really complicated because the focus was a big one. So thank you very much for the question. Well, that system is really interesting. It is open. It is open for the other countries to observe the presentation. They have to contact you, or how they can be able to have access to the system. Well, yeah, the system is open. Of course, the other countries can read and try to uh, know the studies that we have made. Of course, we can contact us. We have this coordinator of the laboratory, so you can contact. Thank you very much, Felipe. There's another question for Gilberto. This question is, if before you made the study in animals and young people, you evaluate before the first vaccine, or is always after the first vaccine? And if it's this a factor into the studies? No, this wasn't a factor because it was after the vaccine. An additional question: these stages of vaccine, it's able to apply to the whole country or just for the borderline zone? It was able it was applied to the whole country uh, in the months of June and May, but also in November and December were made it. But in this zone, especially, it was applying the third cycle just for the animals that were younger than 24 months younger. But for the rest of the country, it was for the two cycles for the whole part fields of animals. We vaccine in each cycle like amount of uh, 30 millions of bovine livestock. That's most of the 90 population of bovine livestock. So in this zone, we are like an amount of 60,000 bovine livestock of cows. Maybe we try to vaccine, so that's less than the 30% of the population. So you feel like you are a services, like you feel like the country has the safest service? Of course, because first of all, we have the whole control of the production of the vaccine, the commercialization, the exchange, the trade, the apply, the monitoring of the personnel, the technician, the veterinarians. We evaluate each person who's going to apply and be involved in these procedures. Also, the organizations involved, and in addition, they show how they take like 85% of the supply, but also all this was involved with a supervision to control all the stages of the implement. Thank you, doctor. Okay, Dr. Carolina, continue with the questions. What's the perception? What's your perception, your knowledge, your criteria about the difference between the monitoring based in risk and based on historically with another factors? Thank you for the question. Well, the monitoring based in risk, it's always enforcing more probabilities to have more diseases. this is the vision for the study, because we have a lot of factors that are involving and responding to the study. So these characteristics, of course, we try to involve different stages, different type of groups, so we can have more control and management. But if we know the risk, if we know the factors, the external and internal factors, of course we can take more control and prevent all the risk involving to the study. And accessibility in the transability between each study with the risk and without the risk, each is bigger, the difference is bigger than the aleatory monitoring. That's because of the lack of resources and also the risk of the partial risk. It's involving more factors. Okay, this question is really important. So I want to ask, how are the resources using in this part of the study? Thank you for the request. Well, all the information and the analysis of data is the main part of the study is involving the campaigns that recollect the information. These studies are based in Mato Grosso. All of them are calling for the catastrophes and recollecting the information that we need because of the population they have in the fields, but also all the species that are involved into the biological disease, the form of production, how they feed this bovine livestock, how the farmers involve the species into the way that we want to study. And so we ask for the details and analyze all the information to avoid every risk that we can't see. So we want to monitoring and control all the risk and external factors that may happen into these studies so we can monitor in the best way. Okay, complementing this question, have you present any data? Well, you present information about 2023, and I wonder if this information is also revealed to the farmers and producers. Yeah, of course, all the information are evaluated for all the parties involved. Along the time, well, depending the timeline, we want to improve and achieve this type of monitoring and type of control, so we can prevent in an early stage all the study and related also to the public sector and the rural areas. We present the strategies that we're going to implement so they can be participate in this type of actions. We also discuss with all the parties involved, so they can see what type of equipment, the advices, and what institutions are involved also into the private and public institution. Thank you for the answer. That was a really important answer. Felipe, from your occupation as a veterinarian, as a doctor, how you can say that IA is also involving into this topic, and how is the projection into the future, like how is going to be the topic into the future? Can you tell us about it? This is a good question. Well, there's not a way to prevent what's going to happen in the future, but I feel that these tools are very useful because they support and complement the investigation and the studies that we want to release. It's not a substitution for the resolution of the problems, but it's a support to, take better decisions or another needs that we may have. Thank you, Felipe, for your answer. This presentation was really important. You say there is a projection of this area of the borderline that you studied. have you took the other factors about the risk and the frequency of the vaccines that you apply? Of course, I made part of these studies. There's another studies that complement not just the borderline of Venezuela, but of all the other borderlines in the south of the country. Mutumayo, Baupés, Amazonas, and Guainís. In fact, into this, the change that we wanted to bring into Colombia was also like this map, like I show you, also brings the transition zones, the south of Colombia, with all these departments are part of this transition, but also they will be recognized more in the future. But this is a reality. Like this type of studies are not just for this type of disease. We also make studies about the movement of the animals, the migration of the different regions, the type of trade of the livestock, of different products of the farmers, the channels of communication and trade exchanges that try to, along the country, involve these studies. And we are going to present all that on the OMS organization more in the future. And all these studies took us here, not also to take a big decision, but also big changes into the institutions and the local, in a local level. Now this week, they are reunited in Colombia, trying to evaluate the different type of changes that we want to bring into the program. How are we going to involve this into the program, and how the information it will be improving the new changes, but also this will build the new structure which each of the uh, particular context of each party, like for example to the borderline, of course we must see, with the borderline of Venezuela we must see and monitoring all the time, because of the supplies with the south of the country, with another zones. We must to see the specific context to see how the study will be. Thank you, doctor, for the explanation and sharing all the information and what's happening in Colombia. Okay, Dr. Carolina, to end this discussion, you mentioned that the last years you change the guilds, and you will change to 2025 the direction, and there's an estimate changing that could be considered as a risk in the future. No, 6% of the supply. Well, we try to involve all the institution for the investigation. We try to discuss how many supplies will be involved. We try to change all the sensitivity into the system. So we want to make a proportional change. Also involve the sectors and zones that weren't involved, but need this type of study because they have a higher risk and need more sensibility, and they need to be more more related with the studies. So related to the other percent, depends of the timeline and the risk that we are going to talk about. One of the risks that we are trying to take a knowledge, for example, is the movement and the high movement of animal, the migration of the farmers and the animal livestock. So we want to identify the different type of information and distribution to make a cutoff of the establishment and to see if the last semester of 2025, which institutions will be involved, so we can see what type of species will we considering as a high risk or external factor that will risk the studies into these institutions and into the studies. So, for example, 12,000 of species weren't monitoring during this migration of livestock, but this depends of the time of the year, but also how many times do we monitoring all these type of factors. And after all the farmer and after all the farmers upgrade and upload all the information to our systems, we will of course know how they trade, how they exchange, how they move the species and the livestock that they have and produce. So this is our one of the factors that we will see. Okay, thank you for the expositors. The participants were really excellent. I will give the final words to my colleague. Thank you very much. Well, it has been a long day, but a really interesting session. This is the final moment for this seminary, this international seminary PRE-COSALFA. I thank you for everyone to be here. I want to welcome to the director of SENASAC, Juan Miguel Quiroz Walter. Please come to the stage to give the final words.
We are really pleased for the presentation of each and every one of our panelists. We have been able to see that it has been a time in which we have invested our time listening our panelists with their experiences, with their knowledge, with their projects, with their research. We are really pleased, and I hope that all of us are present tomorrow, 8:30. Thanks each and every one of you for their participation, and we hope that tomorrow is going to be a productive day, the same as we had today. Thank you very much. Have a good night. We thank the director of SENASAC for his words, and now we are going to listen. Dr. Otorino Cosivi, director of Panatasan, is going to give the final words of this pre-seminar. Good afternoon, everyone. I'm going to be really, really brief. Thanking SENASAC, the products served in Bolivia, for this intense day, for each and every one of our colleagues that participated from the team of Panaptosa. And we're going to be waiting for all of you here in the 51st Symposium for Productivity that is going to start today, 8:30 in this room. Thanks very much. Have a good night. Thank you very much.